Okay, welcome, one and all to yet another episode of WhickTV, a cross-ideological space where we come together, gang. We talk about issues both political and cultural, from the silly to the serious. And today, gang, we're going to be talking about therapy culture, right? What is it? Is it good for us? Has it destroyed us, right? Is therapeutic language helping us to understand one another better, or is it used as a crutch, an excuse by people? Are we over medicated? We have all sorts of things to discuss today. It's going to be great. I've assembled a team and put some people together. They should be wonderful. Happy to have you all. To my chat, Cernus, Infallible Owl, Zephyr Hash, Wolf Glenn, Jenny Burns, nice to see all of you. And as you guys shuffle in, make sure to hit that like button, subscribe button. If you're on YouTube, if you're on Twitch or Kick, hit that follow button, and we'll see what happens. For now, though, let's get on with the show, and we will start with Corey Campbell. Go ahead.
Well, first of all, how dare you slander me by calling me wonderful? But as always, super appreciated being invited on, and always enjoy being here. And don't take it for granted. But yeah, well, I guess opening statement, and intro. So, well, you can find me on Twitch, Corey Campbell 84, Twitter, X, Instagram, YouTube. It's Corey Campbell. I'm a biochemist. I cover science research and news. And a concise opening statement. I think overall therapy and therapy culture, good. And the incorporation of language in our, let's say, lexicon, I think has overall positive benefits. There are certainly shortcomings, but I think just as there are shortcomings for, let's say, healthcare and all that stuff, and even just to use politics and discussing politics. Yeah, you had a panel recently about, fascism and discussing fascism. And, it brings up the question, like, what is fascism? Can we identify it? And so even just there are issues with political language itself. But I don't think it pretty much makes it absent of all meaning. It might make conversation more difficult, but I think overall a net positive. And I think the same thing holds true for therapy and therapy culture. And I'll leave it there for now.
Okay, well, thank you for being here, and you can say you're not wonderful all you want, but I think you are, so appreciate you. 𝕵𝖓𝖎, what do we have?
Hey, how's it going? I'm 𝕵𝖓𝖎𝖙. If you're watching Wiki, you probably already know who I am, so I don't need to go through all that. I'm super pro therapy, and whoever disagrees with me, I'm going to tell them to go to therapy.
Wonderful. Great. Glad we could have this talk. Next up, first time guest on my show, but we're glad to have her here. How do you say your name? Manusha?
Arena.
Huh?
Arena. Manushak is my username. But
Arena. We'll go with Arena. There we go. Arena, nice to meet you. What are your thoughts on therapy culture? Go ahead.
Thank you. Glad to be here. My name's Arena. I make lifestyle content on YouTube, mostly fashion. Just got into film reviews as well, so check that out if you're interested. My opening statement is, as with most things, it depends, and it depends on what kind of groups you are around. I think overall therapy can be a positive. My experience with therapy has been that, at least contemporarily, a lot of therapists practice narrative therapy, which I am not a big fan of. I found that the therapists I've had failed to challenge me and instead were overly validating me. And I believe that in particular is something that therapy culture, at least within the realm that I've seen it, should improve upon.
Okay, well, thank you for being here. We'll see how it goes. Last but certainly not least, no stranger to my show, Ali, go ahead.
What's up, guys? Thank you for having me, Wick. Therapy good because it helps you solve, a lot of problems that you might be going through and dealing with, and it's a good, good to have someone to bounce things off of that's unbiased, third party. Therapy culture is horrible. It no one actually goes to therapy when in therapy culture. They just read headlines and they get definitions for words and just use those to kind of like cope or get to project their own insecurities onto people. And then under the guise of like, oh well, I do therapy, I self therapize. And so therapy is very good. Therapy culture horrible. Plus it floods. Like, it's already hard enough to find a good therapist without everyone trying to find the same therapist, like much less people who don't need it. But yeah.
I'm curious about that. People who don't need it. Can you elaborate on that?
I don't think every single person needs a therapist. I think there are people who are going through things and it's good to work them out with a therapist. But to say that like just the average person who doesn't have this like immense amounts of trauma or something that they're like, why would they go to therapy? What are they benefiting from it? And then it's just taking away from people who do need the therapy.
So there's, I think, a valid question there in terms of like limited resources, in terms of like, yeah, can the system accommodate everyone going to therapy? Probably not, or almost certainly not. Just based off what we know now, there's always a shortage of qualified mental health professionals. But I think the question of whether or not everyone needs it, like, sure, that's probably undoubtedly true. I would wonder if you take the same approach of, let's say, going to the gym and taking care of your overall health.
Does everyone need to go to the gym specifically? No.
Or what about just being physically active?
Yeah, everyone should be physically active.
Being physically active is a much broader thing than specifically going to talk therapy, right? And I think we can gain similar benefits from therapy if you're not really struggling, from other things, philosophy, from having close friendships and relationships. But I would say that if you are truly, I feel that the people who actually do need therapy, who are really, really struggling, will probably have a much harder time navigating the system as it is now. And a lot of therapists, I think, aren't really qualified and or experienced with vast amounts of trauma or have the expertise to deal with it. At least that's what I've found.
Well, that's kind of a crazy thing to say. Can I just get a clarifying from what's your Ali?
Yeah.
Is it?
Yeah.
You say need therapy. What does need mean? Do you think that everybody could benefit from therapy?
Yeah. So the immediate need for therapy. So when I remember when I was younger, I was going through a quite depressive era. I was dealing with a lot of panic attacks I had never been used to. So like one day I don't deal with anxiety at all, and then one day I have a panic attack, and now I'm having panic attacks every day, right? Oof. And the first thing I tried to do was like call my doctor. The doctor just goes, well, you need to find a therapist. So they recommend you therapists, but then I call the therapist and they're like, well, okay, we'll schedule you for 2 months from now. That does nothing for me, right? And so I feel like there are a lot of people who aren't going through things that they need immediately, right? And then they're kind of just using therapy because the culture around it is that everyone should be in therapy if you can get therapy, and then that is blocking people who actually quote unquote like need it.
A follow-up. In your let's say slightly more ideal world, do you think everyone should have a family physician?
Should have like it's recommended, sure, but like
I'm just saying, was that like, do you think that's a step forward in terms of progress, as in everyone has access to a family doctor or general practitioner?
Yes.
Okay. Do you think everyone should do annual or whatever semi-annual checkups at a family physician, or you should only go when you have a heart attack?
I mean, you probably should go. Do a lot of people go? No, but you probably should go. Yeah.
So do you think there's something to be said for, like, in terms of prevention, in terms of, especially when it comes to, well, mental health and physical health? I don't think there's much distinction there. But do you think a better approach is something proactive and preventative, as opposed to, well, now I have an issue that needs to be addressed immediately and I need to react?
I understand that you can learn coping mechanisms before you need them, but to say that you need to be in like weekly therapy or
I never said that.
Yeah, so like no, I don't think. I think you can benefit from it. Sure. Do I think everyone needs it? No.
Just as I would never say, just as I'm sure you would agree that, just as you said, everyone needs a family doctor, but they don't need to go weekly or even monthly. You'd probably say maybe bare minimum annual, or every 2 years, every 2 to 3 years.
Twice a year, once a year. Yeah.
Yeah, sure. Why can you not make the same argument for like maybe every 6 months or an annual sort of like maybe just a screening, some sort of preventative measure, that type of approach?
I just don't think people.
As opposed to now, my depression is like, making me,
I wanna just center this and just kind of remind everyone we're talking about the culture, right? As well as therapy in and of itself, and at least for me, my experience with the culture is when we talk about therapy, they're not talking about in general going once or twice a year. They're talking about going on a regular basis, either weekly, bi-monthly, a very consistent time frame. And I think that there is something to be said. Is this simply like acting as a placebo? Are we using I go to therapy as an excuse not to actually fix our shit?
Yeah, I mean, there was also like a culture of like if he's not in therapy, it's a red flag, just implying that if someone isn't in therapy, that there's an issue with them for that reason as well. So it's like, yeah, it's a weird thing.
Yeah, there was that 𝕵𝖎𝖎 video. I forget what it was. It was one of the dating ones, but the girls, they were young people. They
Women.
removed one of the
Yeah.
candidates because he didn't believe that everybody needed therapy. But I think the bigger issue with therapy culture is, I think, the misuse of diagnostic terms, but still treating them as diagnostic terms. So calling people narcissists, but not just like in a casual way, but this person is a narcissist, therefore we must this, and this. This person is a gaslighter, therefore we must, ostracize them from the group, etc. And just kind of the misuse of these clinical terms and giving them the same weight, but when laymen use them, if that makes sense. So the laymen that are using them in the therapy culture are giving themselves the weight to be able to put these terms upon people. Like if someone's just lying, suddenly they're a gaslighter, when you could just say they lied.
There's two sides of this therapy culture coin. There's still, granted, a much older, kind of dying out culture of thinking that if you go to therapy, there must be something like wrong with you. This person is like, they're like a danger. So there's a lot of people who won't seek therapy because they don't want to be seen that way. Granted, this tends to be older people, but I'm really curious as to how that relates to why did you go to your doctor when you were having anxiety? Because I think that most people nowadays would understand if I'm having bad anxiety, this is in the realm of mental health, not physical health, but you reached out to your doctor. And I think that's a really interesting tell to how you think about your mental health. But why was that?
Well, because I tried calling a therapist or like therapist office, and that's like
That happened first, and then you called your doctor?
No, I had a panic attack. I looked up therapist. Like I asked people what should do. So they I looked up therapist, and then I couldn't get into the therapist because it was such a long wait time. Like I called 2 or 3 of them. So I figured my doctor would be able to recommend me therapists that I could go to. Plus they already know my insurance and they have like my history. So I figured they'd be able to better like prescribe a doctor, if that makes sense.
Sure. And do you think that if the system that, sort of Corey was implying to lay out, that if we had like a therapist that we could touch base with every 6 months or annually or something like that, if you already had that established, because it's something that would be, regularly sort of like in your life, if not just in the peripheral, you would have had a much easier time setting up a more immediate appointment with a therapist.
I mean,
And
yeah,
you wouldn't have to go through that.
I wouldn't be opposed to that, but that's not what the issue is. I have no problem with people like having therapists or like even everyone going to therapy, but like
Sure.
it's just the problem is the culture of it is that everyone should go to therapy once a week. You should have a regular or like at the very least get BetterHelp. Like BetterHelp is a advertised thing which I think it's actually not good, right? Like I don't think I've heard a lot of negative things about BetterHelp. I don't have any. Yeah. So it's just like we're getting to the point where it's like, yeah, just FaceTime this person. And if they're not good, you can find another one within a week. And it's like, I feel like these people aren't the most qualified people if they're on BetterHelp.
Do you know that? Is that like, is it just
don't-
your feeling?
I don't. It is a feeling I have because it's just like, I feel like if you are a qualified and good enough therapist that you wouldn't be on like BetterHelp.
Has been some evidence that,
I don't know about that.
at least in the past, that with BetterHelp, some of the therapists on there weren't actually licensed to practice. So there has been that controversy. I don't know too much about it, but that has been a thing that's been in discussion like the past couple of years. But to go back on the therapy culture topic, I think that the therapy culture is almost informing, at least in the US, I don't know how it is in other places, but I think the therapy culture is informing how therapists practice. And like I mentioned, like a lot of therapists I found practice narrative therapy, which is very validating to the patients.
Can you
and I think that
I hate to interrupt, but just for the sake of my audience, right? Can you briefly explain what narrative therapy is? Because they hear
Sure.
that term, they be like, what are you talking about? Go ahead.
So in short, narrative therapy is kind of about you telling yourself your life story. And it's like a form of talk therapy. Again, I have kind of seen it practiced clinically, but I switched over to EMDR with my therapist, which is eye movement reprocessing and desensitization, which helped me. But narrative therapy to me, I think, is not challenging enough, because it is validating your life to you, in my opinion, instead of challenging you. So telling a
You're not
story
really
with you as
explaining
the
what
main
it
character.
is. That's not really. So just to be clear, narrative therapy is counseling. It is talk therapy, which is what most people are talking about when they say therapy, which you evaluate your problems as something that's separate from you. You don't, it's a way to get somebody to not identify themselves as their problems. So it's something that they can approach instead of having to conquer like themselves. So it's sort of like a step in the direction of getting the healing. It's a way to get an understanding of what your core beliefs are and how they might have led to these problems that are also not you. I think that's just a really weird frame to put that in. It feels a little dishonest when you word it.
You explained it better. My apologies.
Okay.
I definitely I'm trying to remember, because I was actually applying to initially I thought I wanted to be a therapist, not anymore. But when I was looking into programs, a lot of them were teaching people how to practice narrative therapy versus, really psychoanalyzing. But yeah, I'm just personally not a fan, having experienced it. But I think that the therapy culture is pushing therapists to more so validate than challenge their clients, which I think is the bigger problem. And saying basically, like, if somebody comes in and says, this person is a whatever, blah, 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 the therapist will say, oh, that's, how you feel. And
well, I'm just curious. So I am not a mental health professional at all in any capacity whatsoever, even though Dr. K literally steals my talking points. But regardless, how did you know that? So there, just as there are bad doctors, there are bad therapists, there are bad professionals in any professional setting. But how did you know that this is not the treatment for me? How did you know that this, I need these treatment guidelines as opposed to what you were encountering?
I had a very specific thing that I was dealing with. They were specific traumas. I did read the famous book, The Body Keeps the Score. It's a really great book. I really like Dr. van der Kolk's work. And in it, he discussed EMDR. I asked my therapist if she practiced it. Luckily, she did. After about 6 months of regular talk therapy, narrative therapy, I asked if we could switch over to EMDR, and we did. What really made me feel that narrative therapy wasn't helping me is that it wasn't challenging me enough. It wasn't giving me what I needed.
Okay, but
the therapist would basically validate me. Any problem I'd come with, they'd be like, yes, that makes sense. They wouldn't tell me, here's where you're going wrong. And I'd do my best to present.
Well, so without getting into thank you for sharing, but I don't want to dissect your treatment experiences, but I'm just curious, trying to contrast it. So again, these are whatever mental health professionals, arguably medical professionals. So how are you by what criteria are you rejecting these sort of treatment guidelines? As in how do you know that they weren't just following evidence-based treatment guidelines and that you want to go off the evidence-based treatment guidelines?
That's a good question. I think it just felt like a conversation I would have with a friend. I would say the most helpful therapy I've gotten was back in university through the university therapists. That therapist really challenged me. The 2 therapists I've had after that did not, until the one I did with EMDR. And then I tried another therapist after my insurance changed, so I had to switch therapists. And it just felt like they were there almost to have a conversation with me versus to make me think different, give a different perspective on my situation.
Again, without getting personal, but this is somewhat analogous to I've never had cancer. Hopefully, I never do. But this is analogous. If I'm receiving chemotherapy, well, I just know off the bat this is not treatment free. I know that I need this. But how do you know that your doctor? It's good to question them and make sure that they're you're getting appropriate treatment. But how do you know that you're just not rejecting something that's actually good for you? You just don't know it yet.
So here's what I'll say though: is that when I did say, "Hey, can we do EMDR?" she said yes. It feels very patient-led. If my therapist instead said, no, you're not ready for that, we are continuing with narrative therapy, I would have then felt challenged. That would have been what I came to do in therapy, right? But therapy does feel like it is very patient-led. You do kind of, if you want to find a CBT practitioner, you can go ahead and do that. Good? If you want to find a DBT. I don't know. I don't
This
know.
is really
Ollie.
crazy to me.
Well, yeah, 𝕵𝖎𝖎, then Ollie. That's what order we'll go in. Go ahead, 𝕵𝖎𝖎.
Okay, so my last therapist, I thought she was incredible, and if I didn't like something, I could say, "Hey, I don't want this to come back up again. I don't want to deal with this thing." And she can say, "Okay," and I would ask, like, "Well, why is that okay?" Because I want to understand my treatment. Just like if I'm seeing a doctor, say, "Why are you putting me on this medicine instead of this medicine?" Can you just explain it to me so that I feel comfortable? I want to understand. And she explained to me that you want a patient to be a participant. You don't want them to be somebody that you're forcing along with it. So, in order to receive the benefits of therapy, you have to be a participating member. And because therapists, until they really get to know you, they do have to use like a broadly applicable approach. Once they get to know you, they can start to narrow it down and find which things are going to be really good for you. But the number one thing they need is that they need you to be an active, willing participant. So they're going to have to bend certain things that might be the best thing that ultimately for you. But in order to determine that, they're going to need you to be willfully actively participating. Like you need to be invested in it. One of the best things anybody ever told me about therapy is finding a way to pay for therapy is part of therapy. And I thought about that. And that means that if I say I'm not going to go to therapy because I can't afford it, that means that I'm not willing to bet on myself. When I came up with $200 for that initial visit, I'm saying I'm going to bet $200 that I can get better. I'm going to put this money down and say I'm betting on myself that this $200 in me being a better version of myself is going to be worth it. And that I think is a great way to get yourself in the mindset of being a good active participant in your own therapy. And so I think you need to cut your therapist a break. You
Gang,
have to
if
like
you want
them
to
at
bet
least
on
a little.
yourself, donate to WhickTV. Bet $5, not 200. Well, you can if you want, but $5. You will bet on yourself. You may win, you may lose. I don't know, right? Well, I can't say.
Sorry, Wick. I don't feel like you challenged me
Fair
enough.
enough.
Just kidding.
But I want to toss the ball to Ollie for a minute. Go ahead.
Yeah, so I mean, 𝕵𝖎𝖎, I want to address that. I don't like the idea of like making it so that the person isn't betting on themselves because they don't have the $200 to put up on the initial front, because it's not just a $200 initial front. You typically, once again, with the culture of therapy, it's like recommended that you go weekly, and that's how people have it approached. And then I'm so sorry, I can't remember your name. It was Amina?
Arena.
Arena. Okay, so one letter off. Cool. What you brought up was kind of like my issue with therapy culture, and I'm to 𝕵𝖎𝖎's point too. So it's the same thing with like medical culture becoming so like popular. People would look up their ailments and then they would go to doctors and they would go, "Hey, this is my issue. This is how I want to be treated." Right? And so because they felt like they were informed and they could look up things and they're within the culture. My friends are doctors, so on and so forth, or my friends are in med school, so on and so forth. They would go to doctors with their own ailments, what prescriptions they want, and how they want what treatment they want. And I think that's the same thing that's happening with like therapy too, right? Is like people have looked up so many different types of therapies they like, dislike, that they're going to therapists with their own plan of how they want to be therapized, and it's just like that. That's not how that works. Like it's like you already did the therapy at that point.
Yeah, that's why I asked the question of like again, without getting too personal, like how was Arena like? What criteria are they doing to reject it? Like I recognize,
I know what you do.
I recognize that there are bad doctors, and as a patient, myself, like you should advocate for yourself, but it's a fine line to use maybe a loose example of like Trump and their legal approach of like. There's a point of like questioning your lawyers, okay, and there's a point
we'll
of
see
like
how
getting a
this
second opinion.
metaphor goes. Go ahead.
But
I'm
if you're rejecting every single piece of legal advice until you find the one that matches what you want, then that is a problem. I think that's a recognizable problem. Like, yeah, I'll reject all the 10 lawyers that are telling me the same thing until I find the 11th that just happens to give me what I want. If that's your approach to therapy, I don't think that's good. But I'm not really qualified personally.
But that's how well, we're talking about the culture, and at least from what I can see of the culture, that's what everyone is told to do. Shop around for your therapist, right? Find one that works for you, quote unquote, right? It's all about like never being told no in a very real way. Like
so
never being told, you don't have this. Because I've heard people like, "Oh, I know I have ADHD. I know I do." and they will find a therapist that will tell them yes. And you have this
Yeah.
incentive structure, especially in America, an incentive structure where the therapists who will tell you yes get money,
They're not
right?
looking for therapists. They're looking for copium dealers. That's all they're looking for.
Yeah, but you
Yeah.
probably never advocate of like, if you happen to know someone that, they went to their doctor or whatever, and they received a cancer diagnosis. You probably wouldn't advocate for them to like shop around until, you get that false negative. Like until the mistake is made, that like, yeah, they don't actually detect it.
So-
Shop
like-
around though, but you can get like a second opinion,
Yeah.
which is
I said that earlier,
Yeah,
but if you're
yeah. Oh,
getting
yeah.
if you're getting a fifth until you get the one that you want, like that's a problem.
yeah.
That's why
This
I was like
is
asking the question.
this is a big problem with therapy culture. But I think it still stems from you're not really being an active participant in getting better. You're being an active participant in finding somebody to tell you that, hey, you're right. You know what? When everybody tells you all these negative things, you're not fucking narcissist. Even what they're saying doesn't even sound like in the same ball field. You're actually just that fucking great. If that's what you're doing, you're not really trying to get therapy. You're trying to get somebody to jack you off. You're looking for a prostitute. Okay,
Elder Drowsy,
You just
that's
want somebody to make
exactly
you
the
feel
problem
good.
I encountered
Well,
with my
hold on.
therapist.
Let's go to
Oh, sorry,
Arena, then we'll go to Ollie. Arena,
Sorry.
then Ollie.
Yeah, Elder Drowsy, what you're describing there, that's the issue I found with my therapist, is they would not challenge me. They would just tell me, you're doing great. Look at you. You have a job. You have a degree. You have this. You have that. And I'm like, okay, but there's all these other things, right? And so that was really the frustrating thing for me, is I wanted to find someone to tell me this is,
You do need to shop a
What you
little.
need to
You
learn.
need to find comfortable. If you're not comfortable because you're being told yes too much, then sure. But what Corey still stands is that you need to know that you don't know better. When I go to the doctor, I'm a fucking crazy nerd and I'm germophobic, so I do look everything up. I'll go, this is the stuff that it sounded like to me. That if that helps inform you, like I know I'm not a doctor, like whatever you say, I'm gonna listen to, but like I couldn't help but look stuff up. So there's a bit of humility, even though I am going to like psychopathically look up all of my symptoms. But I also know that I have to respect the professional. And I think that's
of course,
the best kind of
yeah.
approach in the digital age.
I respected that I have no diagnoses or anything like that, and I respected their treatment path for me. And I've graduated from therapy. So it's not the not respecting, it's just that I think the culture as it is needs to challenge patients a bit more rather than just validating them at every turn.
I'm super curious. So it seems like people are pushing back on this culture therapy, and to me, use an interesting term or a phrase like you graduated from. I don't know what that means of like graduated from therapy. Of like you got a badge, like you are now mentally well for the rest of your life.
My therapist said that I don't need any more sessions. My therapist said you're doing good. You don't need any more sessions. That's what I mean.
Isn't that the goal? And also, thank you for the gift sub to Testy Johnson. And thank you, Testicle Johnson, for the $2 to say emotions are dumb and should be hated. Hatred is an emotion too, sir. But yes, isn't that the goal, to graduate, quote unquote?
I'm not a mental.
No longer need the therapy.
Again, I'm not a mental professional, and obviously it depends on what type of condition that we're speaking about. But like, yeah, there's something to be said of like the therapist empowering you with the tools to hopefully now bring forward in the rest of your life. Same thing, as let's say my approach as like prior as like a personal trainer. Like, yeah, at some point I would want to empower my clients so they can do things on their own. But I would never say like you've graduated from personal training and you can just stop exercising type of thing. Like you're done. You're now physically healthy. I don't know if it works that way. Pretty sure it doesn't. Well, but like, yeah, if you're provided tools that you can carry forward, then yes, that's. But not everyone has that. Not everyone has that experience. That's all I'm trying to highlight.
When I quote unquote graduated from therapy a long time ago, when I was younger, the reason my therapist gave me said, "Look, I think that you care enough about your mental health, and I think that you have the tools available to you to guide yourself. And we've worked through all the things that you came here for, and I think that you're going to know how to handle yourself, and that if you need to get back into therapy, you're going to understand when that time is for yourself." So that was me graduating therapy. So if you have somebody to where like if you're a personal trainer and you get there and they've already like done a third of the stuff you're going to have them do, you might be like, did you even need me anymore? Like, you seem like you got this shit down. Like, honestly, you're paying me a lot of money, and I have other people that I could be helping. Why don't, like, if you want, why don't you take 2 weeks off and see if you still need the motivation and guidance of a personal trainer? Because if not, like, I think you're nailing this. I think it's kind of like that, right?
Yeah. So what you've outlined, like, I don't disagree with. I'm just like, to like bring back in sort of like therapy culture. A lot of people use the term of like, well, I've been to therapy and I've done the work and now book closed, chapter closed. Same thing with like just as I would never take the approach. That's why I tried to use the analogy of like physical activity. Of like, yeah, I've done physical activity. No longer need to do it anymore. That's just like a bizarre concept to me. It's like, just as to maintain your physical health, you need tools and whatever regular practices to incorporate into your life moving forward. I would say the same thing holds true with mental health, but many people don't approach it that way. They just say, I've graduated therapy, I've done my 12 sessions, now I'm good and set for life. And it's like, well, not my place to, I guess, really challenge that. But that seems a little
gonna toss it to Ollie for a minute, and then I have a question that might drive us along a little bit. Go ahead, Ollie.
So even though I'm pro therapy, I think people, if you're having problems, you should go to therapists, and maybe even a little bit of prevention if you want to go once a year, once every 6 months, whatever. Cool, I'm with that. My experience with therapy was absolutely atrocious. I was having panic attacks. I couldn't find a therapist immediately. Then when I finally agreed to meeting a therapist, like within the 2-month period they gave me, waiting period, I had to see a psych first. I saw the psych. I got prescribed SSRIs and benzos, and then I got hooked on on benzos. I didn't take the SSRIs because I didn't want to deal with that, because the initial, listen, when you're having panic attacks that are debilitating, and then the psych tells you, hey, so you're not these might not make you feel great immediately, and if anything, the panic attacks might get worse for the first 6 weeks. I'm not dealing with that. I'm sorry, not doing that. That's
So I didn't follow the rules. I had a really bad outcome. So therapy wasn't very good for me. Like,
no,
what?
Well, I didn't want to be put on medication. I wanted to just talk therapy.
Well, you still took the one medication you did want, and there does seem to be a correlation between depression and your ability to be more susceptible to addiction. So maybe if you took the thing that would have helped you with your depression, you may not have been as susceptible to having the mental addiction to the benzos, right? Is that possible?
No, because I didn't go to the therapist for my depression. I went to the therapist because I was having panic attacks. The benzos that were prescribed band-aided the panic attacks, which allowed me to get through the day. I couldn't, whatever. So I wasn't, so I
took half of the medical treatment. So a psychiatrist is also looking out for your mental health. They said, here are 2 medications I want you to take. You're like, well, I'm just going to take this one and not this one.
I'm not blaming the prescriptions that came to me.
No, you're blaming the process, but you didn't follow the process the way that you were supposed to, and then you're turning around and pointing, I had a bad experience here. Sounds like you created a bad experience. You can't. At the very least,
doesn't want to be put on medication, and you don't want to take medication for a while, but you have to take a medication that band-aids your ailment.
Okay, so
right?
Wait, all I'm saying is that you're saying this was the thing that was wrong.
I mean,
but I also didn't follow through the process the way that I was told to. So all I'm saying is that it's weird to blame the thing when you didn't even do it. You didn't hold up your end of the bargain. So it's weird to blame your experience with therapy because they made you do something you didn't want to do. You did it. You were told to do something. You only did the part that you wanted to do and said, I had a really bad experience. Maybe you would have had a better experience if you would have followed the process the way it was recommended. And even if not, I don't think you can then turn around and say that it was that because you didn't do it. I would have
just been on SSRIs that I couldn't get off of. That is also a problem.
Well, this leads into
be on the benzos.
This actually leads into my question.
Yeah.
This actually leads into my question.
Well, I know, because the way that was painted, absolutely not. So no, I didn't go to therapy for pills and medications to be treated like that. I wanted to do talk therapy. However, when you're having panic attacks specific help, I didn't want my depression treated with pills. I don't want my panic attacks treated with pills, but I can't get them treated with the talk therapy that I was searching for. So the only way I can treat the panic attacks that I'm having was with the benzos that then I got hooked to. It has nothing to do with the depression because I got off them without the therapy and with weaning off. So it was like it was more of a dependency than an addiction thing.
But
I know we want to go into.
I just don't like the way that was framed.
Sure,
but, yeah.
I will ask the question, and you guys can continue to talk because this bears into it, right? part of therapy culture is also medication culture, right? And your experience mirrors the experience of many I have heard from who want to go to therapy but are prescribed pills, right? They feel like they are cast off in a way that well, we don't really have time for you right now, but here's some pills, take these, and we'll kick the can down the road. If they don't work, maybe you can see me later, right? And I think that this bears into the larger culture of, well, of being over medicated, right, for these things, it's you can't graduate, right, if you are consistently addicted to SSRIs and these other things like that. So I guess the question would be, do we over medicalize? Yeah, over
Medicate?
Medicate.
prescribe.
Over
Medicate.
medicate, yeah, or
Over
over
medicate,
well, yeah. So just to attempt to answer your question, and also to address what Ali and Elder Drazi were bringing up of like, I think Ali, I think you were pretty much like, from what I can tell, like doing what I was alluding to earlier, of like you were trying to curate your particular treatment, of like you wanted to reject, like you had a particular idea of like, this is how I want, you know, my medical professional, psychiatrist, assuming if they're prescribing, almost certainly they're a psychiatrist and they're a medical professional. It's almost like going to like, you know, if you have a diagnosis of cancer, I don't want the chemo, I want the crystals. I want some sort of crystal therapy. It's like, well, by what basis are you rejecting what they're recommending you? Yes, the doctors make mistakes. It totally might have been a mistake. But I think there's what Elder Drazi was bringing up of like, you didn't actually follow the treatment protocol. And then you're surprised, or like, I don't know how you can say that you had a negative experience with a medical professional if you didn't actually follow what they were saying.
My experience with okay, so when someone's seeking therapy, okay, so unless someone is okay, so if I have ADHD, right, and then I'm seeking out a doctor because I want to be prescribed Adderall to fix that thing, there's no problem there. If you have to go find out if you have ADHD first. They're not just gonna prescribe you Adderall. They're gonna find out that you have this thing, probably to see if they can treat it without the Adderall first, hopefully, and throw it. So with my issue was, I didn't want I did not want to be on pills as a treatment for the anxiety that I had. So in my opinion, that's the proper way to think about therapy. Is I'd like to go see a talk therapist, deal with the issues without medication. But my experience was, before I could see the therapist, or I had to wait 2 months to see the therapist, I got hit with the psych, and then I instantly got prescribed Xanax and SSRIs. And it was like, well, I mean, I'll use the Xanax because it's gonna treat the like panic attack that I don't know how to deal with or cope with, or I don't know what to do with these things. I'm waking up and I'm not able to go to work, right? Because it's
So
like,
there's something really important here, and I'm like, I have to actually be a little bit personal to address what you're saying here.
go off, I don't
When
care.
you got prescribed the Xanax, what was the prescription for? Was it to say take this every 4 as needed, no more than every 4 or 6 hours, something like that, or was it or was it take it every so often on these like marks? Because okay, go ahead and answer, and then I have a follow-up question to that answer.
It was prescribed to take as needed twice a day, like, you know. Yeah.
Boom. Okay, so if you had taken an antidepressant alongside this, there is a very good chance that as you're waiting for the SSRIs to build up into your system and become an effective means to stop you from having panic attacks, because depression and anxiety kind of go hand in hand. We're talking like spaghetti and meatballs, peanut butter and jelly. Okay. If you see one, there's probably the other one there. So if you were taking the antidepressants as you're supposed to, that as needed amount goes down. Your likelihood of getting addicted goes down. And maybe it turns out that you didn't need to be on medication long term. You needed that talk therapy, but you did need something to help you for those 2 months while you were waiting. And if you had followed as prescribed your medical treatment, instead of deciding, I actually know what's best with this medical treatment, I didn't need these SSRIs, I just needed this as the Band-Aid, you are still making a mistake in thinking that you know better than the doctor, and you are taking a medication that is, you are increasing your risk of addiction by not taking those SSRIs along with it.
I think, but what
it's just,
I mean, sure, I mean, sure, I never said I was smarter than the therapist, or that I knew better, or that what I did
you
was
behaved as though you were. And that's what I'm saying. And
the
then
problem with the culture that comes with it is people will tend to behave in the way they were. But also the other problem is, a lot of people do not want to be hooked on pills in general. So especially when the side effects of those pills that are thrown at you in the commercials, and if this doesn't work for you for the first 4 weeks, your panic attacks might increase. Not taking that risk when I've never had panic attacks before, and if I only have to wait 2 months to see the therapist, I'm not dealing with 6 weeks of side effects before I see the therapist.
Yeah, let's
So,
toss
like,
it to Arena real quick and see what she had to
I
say.
was going to say, I think Ali's experience kind of demonstrates that the people who do really need that psychological help, and I think this is parallel also with people who are very much in the medical system, people with chronic illnesses, people with disabilities, they have a harder time navigating the system, whether it is because of the waiting times, whether it is because of dismissal, or if you are in the state that Ali was describing, maybe you're not in a position to be following a certain protocol without maybe extra guidance or like check-ins from a therapist or psychiatrist. And I think the harder of an issue you come in with, the more likely it is that you're going to encounter those negative experiences because you're just in the system longer. So it's not, I think, that the system period is bad. I just think that the more complex of an issue, the harder it is going to be for the providers to effectively treat and support the patients. And especially, yes, the system is overburdened and underfunded, et cetera, et cetera.
And to answer the original question, Wick, since again I'm absolutely not a medical or mental health professional in any capacity whatsoever, so I can't say with any confidence about overprescription, over medicated. I don't really see any hard data to point to that. I think it's possible for sure, but I think you have to tease out, or it's hard to distinguish that between is it like intentional overprescribing, or is it like maybe Ali, you have the mirror image of Ali. I don't want the talk therapy. I want the medication. Give me the medication. And now they're requesting the medication. That totally happens. So is that, is that overprescription?
There is data to suggest that there's over medication. It was quite a while ago. I think it was roughly a little over 10 years ago. Newsweek came out with a study that showed around 75% of people taking antidepressants did not actually suffer from like a chemical imbalance causing the disease depression. They may have been depressed, but they don't have depression. Now, this is obviously over medication is an issue. We all know somebody who determined themselves that they had ADHD, and they shopped around to find somebody who would give them Adderall. Everybody knows somebody who's done this. If we don't know them, we are them, or like we know somebody who knows them.
I was
for
that one.
sure. and as somebody who has had if you've seen me stream, I have. It's undebatable. Like you see me go, oh, this guy has ADHD. I was diagnosed like 4 different times by different doctors my whole life, and for a long time, I didn't want to take ADHD meds because it made me feel bad about myself. Now, as an adult, I realize I don't care how I feel about myself. I have to take my medicine like I'm supposed to so that I can be a functional human being. There's 2 sides of medication culture. There are people that are insanely against taking medicine as though it's going to put some hex on them. They're walking around with a big sign on the back that says fucking loser, or like I can't deal with life or something.
Or
and there's people that accuse people of that. Sure, but I'm talking about the internal sense that people have against medication. Like you said, well, I didn't want to be on pills. Why? Why are you deciding that pills are the wrong answer ahead of time? And then there's the other people who think that I'm going to take as much shit as I can get because like somehow this gives me, if I can hold up a pill bottle and go, look, you can't I'm allowed to be this kind of way because I'm sick. See, I have my pills. Like there's both sides of this are insanely destructive to the individual, and it's really bad to society at whole. We need to find a middle ground where we can accept that doctors probably aren't in large trying to overprescribe people to line their pockets with money. And at the same
Speaking
time,
of lining my pockets
maybe
with
we
money,
could use
$5 from Testicle Johnson to say America's
meds.
most highly prescribed for psychiatric medicines in the world. So
Wait, so then you have problem with you have no problem with pain clinics just prescribing Norcos and Vicodin to people who just have pain instead of telling them to try to deal with their ailments like in a more natural, holistic way first?
No, I don't think many people end up
Arena
at pain
had to
clinics
go
as
for
a
about
first stop.
15 minutes. She'll be back in 15 minutes, just FYI.
No, well, a lot of people
pain
do.
clinic
What I'm
is-
saying is if someone's in pain, do you think their first form of treatment should be go on pills and just be on pills for the pain, or should they try to treat the pain first?
So what this is pretty rare. You don't usually get to. Very few insurance companies are going to allow you to walk into a pain clinic as your first stop. Usually, if it's your general practitioner, they're going to recommend some stuff. This is how people end up in pain centers. They say,
They were
okay, here's what
prescribing
I need you to
oxy
do.
for
You
headaches
need
at a
to
point. Like,
okay. Anecdotes are anecdotes.
it's
What
not
generally
anecdotes
is going
that
to
happened
happen?
in like the entire country. We had an oxy epidemic because doctors were prescribing oxy at like high doses. They were told to prescribe oxy, and the people that had the pain, that like whatever, even if they had a slight pain, if they had the
Sure.
sciatic pain
Yeah,
or
this
whatever,
was
were
a
hooked. So this
real
isn't an
issue. It
anecdote.
was
This
well
is like
documented. It's
we have an
going through the
opioid
courts,
epidemic
I
in
believe.
America.
I understand, and I'm talking about part of this is what happens is say I have back pain. Doctors say, okay, here's what you need to do. You need to do these stretches 2 or 3 times a day, and come back and see me in about 2 months after doing it. Let me know how this is going. Also, you need to not be sitting so much. People go, okay. They come back, go, yep, I did everything you told me to do. They didn't. And then I say, okay, so we're going to look at some options for you. And sometimes people end up at pain centers. Also, part of the problem with the opiates is that everybody, doctors included, were lied to about opiates for a really long time. They were told
Yeah.
that they were non-addictive. They're basically
I
seen
know.
as miracle drugs. Like, we solved the pain problem, you
And
guys.
people should be skeptical of the companies that are selling them pills. So therefore, they shouldn't be. They should kind of be skeptical of like, well, should I be on pills or not? That's kind of like why
Because
people are. They don't want. They don't
one
trust
flavor of
pharmaceutical companies.
medication has done this, so that we have to be skeptical of everybody to the same degree as though it's going to have the same kind of like
When
terrible
you
effects.
cause an
I don't think
epidemic,
so.
yeah. Well, first of all, when you cause an
Sure.
epidemic, 100% you're skeptical of the of the entire pharmaceutical pharmaceutical brand at all.
I
All
don't
of
think
them.
that because of opiates, we need to look at medication that have been around for 30 years and
What
don't
about
seem to be
benzos?
causing people to be dying.
Well, wait, is there any evidence? So as 𝕵𝖎𝖙 brought up, like medical professionals like were lied to, hiding like somewhat analogous to what the tobacco
benzos
industry
or
did.
overprescriptions?
Yeah.
Because like overprescriptions of benzos, it's gonna be anecdotes for me all day, and also like every housewife will probably can probably attest. Fam, I know women that were essentially drug dealers with the amount of benzos they were prescribed. They had jarfuls. Like
Sure,
an
but
like
And
an
we're,
I've had
expensive
some
and we're
too.
talking about the oxy issue. When we're talking about the opioids, right, in general, right,
Oh.
I think it's pretty well documented how overprescribed and pushed they were by pharmaceutical companies onto
Mhm.
the doctors, right? They were
Yes.
given money to push these drugs and use these drugs and prescribe these drugs in place of other medications, right? There were a lot of financial incentives for them to do so. The pharmaceutical companies did lie to the doctors, but that doesn't change the fact that these doctors did overprescribe them. $10 from Infallible Fowl to say, growing up, they wanted to put me on Ritalin, but my parents were afraid to try it. My grades slipped, and I was a weirdo, so they probably would have helped. Meds aren't for everyone, but some need them.
Yeah.
So,
So I
if I
think
may,
we can all
if I
agree
may,
that there's
just real quick,
okay.
and I'll let you respond. To that point, right? Like, I understand what you're saying about how people should be skeptical and you shouldn't just like trust everyone just out the gate. But there comes a point where you do have to trust, right? Where you do have to say, okay, well, if so many people are telling me I need this drug, maybe I actually do, right? Like, we can't just live with constant paranoia.
Facts. Agreed.
Yeah. I've also talked to doctors about specifically this, and I've even actually talked to a woman who came from medical research who was headed to a conference with like the United States government leaders over the University of Michigan. They had a conference about it because I was a Lyft driver, so I get to meet interesting people. And one of the things that was like a big focus of this was that doctors seem to be in a position to where if they want to do what's best for their patient and they know that their patient is going to leave and find somebody who will give them the opiates, that they're going to give them the safest doses that they can and still keep their patient while also trying to provide them with the best medical treatment they can. It's sort of a lose-lose for a lot of doctors who go, I don't want my patient to be on opiates. I don't think they need them, but I know that they're going to leave because they keep pressing the subject. So I'm going to try to do it in the safest way possible.
Yeah, so I know you want to. I'll just build upon what 𝕵𝖎𝖙 is saying. To use a somewhat related example of like it's a no-win situation where people in my opinion United States healthcare is consumer-based healthcare where it's like you get to shop around and like if you're not satisfied or if you're not getting the exact treatment that you want you can switch and a good example in my mind, more closely related to my field of like, this is a problem with, let's say, antibiotic resistance, where a lot of people go to the doctors when they have a cold, which is a viral infection, saying, hey, I need something for my cold. And well, an antibiotic's not going to do anything for that. But many people have in their mind of like, when I go to the doctor, I'm supposed to be prescribed something. So if I come out of that office empty-handed, well, I got bad medical treatment. You might get a bad review. And so many doctors will, like this happens, we overprescribe antibiotics. Like I would say there's a lot of data to back that up. And this is largely driven, or part of it is driven, is because, like, yeah, just to acquiesce or, to satisfy the patient of like, well, I want to get them off my back. Like, yeah, this antibiotic's not going to do anything for your cold. But hey, you want something, so here it is. And I think that happens way too often.
Try
Well,
vitamin
first
C.
of all, thank you to Brittany Simon and her viewers. Thank you for tuning in. We're talking about therapy culture and medicalization in America. It's an interesting discussion. Kick your feedback up. Take a listen, like the stream, etc. $10 from Artemis Fowl, not to be mistaken from Infallible Fowl. I am looking forward to the second hour and call-ins. Can anyone tell me what was the third leading cause of death in the U.S. before COVID came?
I see no reason to entertain any questions by Artemis Fowl, since they never answered my question about 30 million
They did pay me
undocumented.
$10, so.
I know they did, but until they actually back up their bogus claim of 30 million in the 1990s of undocumented immigrants, I see no reason to answer anything or take anything that they say seriously.
He should give us $5 and tell us the answer.
Yeah, it was. I'm pretty sure that prior to COVID, that the third cause of death was I think what they're getting at was probably opiates or something along those lines. At least if it wasn't, that's believable to me. Sure, that's fine. The other side of what his name's Chris, right?
Me?
Corey?
Corey. I'm super bad with names. I'm sorry.
That's okay.
The other side of what you're talking about with the antibiotic resistant thing, I had a bacterial infection in my chest. I had upper respiratory infection that was bacterial, and my doctor refused to give me antibiotics. The nurse came in and said, well, he's giving you, it was like either Tylenol or ibuprofen. I said, wait, why am I not getting antibiotics if I have bacterial infection? And she said the doctor doesn't like to prescribe antibiotics because of bacterial resistant or antibiotic resistant bacteria. I'm like, wait, so I can't get treated because he's afraid of, like, this is bullshit. I was like, I want to talk to my doctor. If it's a virus, I agree. That shit's crazy. In some cases, if somebody has a really aggressive upper respiratory infection from viruses, antibiotics are given to help prevent bacterial infections from forming from the damage that that can be caused by that. This does make sense, but I think that what you're talking about does happen. But the other side of the coin is that sometimes doctors get paranoid, and then asthmatic people like me don't end up getting antibiotics when it's like, this is the treatment. Like, what are you doing? I have to be miserable because you're afraid.
It's a no-win situation. I don't know.
And this is sort of the dichotomy that I see with medication culture in general. There's some people that see people that have had such bad experience with medication, or they just have this idea in their head of what medication means to be on it. And I think that we all just need to take a quick dose of reality and say that medication exists for a reason. There's some people that need it. If you want to have your doctor explain to you why it's getting prescribed, make sure it makes sense to you. Make sure that you get a good understanding of it, but it shouldn't be coming from this feeling that you have that medication is bad.
Well, it's not medication is bad. We have an idea that the only reason this medicine really exists is so that pharmaceutical companies can make money off of it. So it's the people that are making and giving us the medicine that are bad.
The only reason any product in the entire world exists is because people want to make money off of it. But that doesn't change the utility that exists in the product within. Cars exist because people make money. You don't go, well, should I really trust my vehicle? Like, the only reason that they're trying to market a vehicle to me is so that they can make money.
People don't like
is it going to get me where I'm going?
We don't like seeing medicine as a product.
Right, because of that feeling that we have. That's what I'm speaking to.
Well, because the people who are selling us things can be just lying to us to sell us shit, which they have done. Okay. So it's like, why would
That's every product ever?
Well, without getting...
This is medicine.
Without getting too off topic.
I'm not addicted to my car.
But, so, yeah, seeing medicines as a consumer product, I'm wondering, again, this is maybe too tangential, but I think it begs the question of, like, how do you feel about pharmaceutical advertising? Because the United States is one of the only countries in the world where it's legal. I think New Zealand is the only other one.
I don't like
where you're allowed to market pharmaceuticals. And maybe that's one of the reasons why medications are overprescribed.
It
It's
shouldn't be
because
for
like
profit.
since it's consumer driven, and if you see a commercial, don't the commercials very often say like ask your doctor about this? So like, isn't that pretty much just like consumer based medicine?
Yeah, and I'll be the first one to say I agree. We should have universal health care. We should have the ability to negotiate with drug companies to reduce medical costs for people since we don't have it. We don't have a lot of things that could help reduce all of these things. So we live in the world that we live in. That does not mean that we have to go around thinking that all pharmaceutical companies are going to give us something that's going to kill us. We have to understand that there are situations that really our lives might actually depend on taking preventative medicines. I have asthma. I have to take medication to control that. If I didn't trust the pharmaceutical industry to like the insane degree that some people do, I'm dead. Okay, I don't take my controller medicines. I don't have a rescue inhaler. I'm going to die,
Can
like
you be
the worst
addicted to
kind
your
of death.
inhaler? If you can be addicted to your inhaler, sure. People are usually skeptical, specifically of drugs that they have to be on for long term.
I
That
kind of
they
am.
can't get off. You're not addicted to it. You need
Well,
it. There's a difference.
so here's the thing. If I realize that I'm far away from home, if I can't get home in like 2 hours or less, and I realize I don't have an inhaler, that can cause me to have a panic attack that will trigger an asthma attack. It's like the only way that I can freak myself out into having an asthma attack.
Yeah, but that's not because of withdrawal. That's because you're panicking that you don't
That-
have it.
well,
That's
that's why I
worse.
said
That-
kind
that's a
of.
completely well. That's why I'm
Yeah.
saying no, because like the flip side is I'm addicted to benzos. I'm addicted to Vicodin. I'm addicted to these drugs. I have to get larger doses because I'm not now tolerant to the lower dose that I'm taking. I then get onto heroin. This is like what these are the issues. It's not so much that like every medication is bad. Most people aren't skeptical of inhalers. They're skeptical of things that they can be addicted to or SSRIs that they have to be on long term, and that is known that you can't just get off an SSRI. You have to wean off the SSRI.
How would you
So
feel
it's just
about
like-
people getting prescribed addictive medications being required to take therapy alongside their treatment with addictive substances? Because one of
Therapy
the
first.
highest associations with addiction is psychological issues.
Therapy first. I want you to see a therapist twice before you get put on any medications.
Okay, and then and ongoing while you're taking
Because
it.
what's going to happen? Yeah, sure. What's going to happen is what happened with me, which is I'm going in for panic attacks. I'm not going in for depression. You give me this thing that helps me not have panic attacks anymore. All right, cool. So I can just figure this out on my own if that's the case. I have this thing that helps. Oh, well, I stopped going to the doctor. Now I'm just going to urgent cares, telling them while I'm having panic attacks, they're prescribing me benzos. Now you take it from them. Yes, this
Shit.
is how people do it. Yes.
You're
And
good.
then-
you got benzos from an urgent care.
Oh,
You're a
regularly.
fucking wizard, dog. Oh my
Regularly.
god.
Go in while you're having a panic attack. It's the best.
Okay. In the meantime,
Don't do that. Don't do
Don't
that.
do
20
it. But that's what happens. It's what happens, and then
Yeah.
then you have this long line of addiction. So I agree that it's the patient is also the problem. Like I'm not saying the patient isn't the problem, but that's kind of like the issue with like the culture of therapy, like having therapy culture, is that patients feel like they can treat themselves because they've looked it up. My therapist is going to take 2 months to see me. Fuck them. Like
I mean, we're really
You know?
ignoring the real problem here, right? And it's TikTok. Everybody
We'll get
sits
to
on
that.
TikTok and gets convinced. Oh, is that the
we'll
next
get to
dude?
that. We'll get to that.
I
I
hate it
promise.
so much.
Here we go. $20 from 𝕻𝖎 to say, thanks for poisoning the well, Corey. I have an opinion on a topic. Has nothing to do with the current topic. Many studies linked third highest cause of death in the U.S. is medical malpractice, not
Oh,
just
okay.
pills. WhickTV has them now.
They poison the well themselves
Has
by
pills? No,
is
I don't
it-
have pills. I'm not on drugs. But $5
Yeah.
from Testicle Johnson to say, have all the people pushing medicine tried going for a run and eating kale?
Yeah, I went for a run
Okay.
earlier today and consumed some kale.
Wait, who said
Absolutely.
that?
That was 𝕻𝖎 for the third highest cause of death comment, and then $5 from Testicle Johnson for the kale comment.
Testicle Johnson. Fuck you, dude. I used to be in good shape, and yeah, it helped. All right. I can't run. My fat ass has asthma.
Back
I
to
think
the
trolling.
back to the
I
issue
know
at hand, right? Back to
Yeah, I know.
the issue at hand. Let's talk about both the, for lack of a better term, social contagion when it comes to ADHD, bipolar, dissociative disorder, etc., etc., etc. All these diagnoses, as well as the quote-unquote medical malpractice and the state of the industry and how many bad actors there are within the industry. So let's tackle the contagion bit first. First of all, anyone want to push back on that there's a social contagion when it comes to these things, or
I don't know about social contagion, but I would say like absolutely on social media, there's a flood of poor quality or just straight misinformation, disinformation. That especially on TikTok. Like I'm gonna post a study in the Discord chat of like like half the information, at least based off of this study, like about ADHD, is just like whatever, basically just straight misinformation, disinformation. But that is that's what seems to be the most popular on TikTok. As in the study I'm going to link, they're like the medical professionals that are on social media that are giving accurate information, like they're getting the accurate information, but like it's not getting traction, as opposed to the poor quality information, the disinformation. That's what tends to go viral.
why?
Well, I think for very often, like they don't provide, let's say, a causal explanation in this study. But I think as sort of what we're
Yeah, use your guess. Like, what's your instinct here?
Confirmation bias of like instead of I guess being challenged getting the accurate information, like they're going to hear the message that appeals to them the most, and that might be like the disinformation. Well, same thing with like any sort of conspiratorial thinking or largely speaking inaccurate thinking, so to speak.
Wait, are you
Just like,
really
confirmation
so
bias.
you really thinking about it? Because like let's be real, it's marketing, right? People on TikTok, they're already where people are looking. They're already people that people like, and then when they say this stuff, they're already, their minds are open. They're not shut off. When somebody sees somebody saying, "Hey, there's something wrong," and it conflicts with what they say, you have to be likable. People that put out studies and talk about things, like medical professionals that talk about things in a medical setting, it's not sexy, it's not funny, it's not entertaining. So people are shut out from it. That's why some of the best movers and shakers in our society are like comedians. Comedians that talk about political issues are really great at getting unpopular ideas out to the public because they're funny while they're doing it. Medical professionals fucking suck. People that do research fucking suck at talking to the masses because they're boring nerds. Who wants to listen to a boring nerd?
That's almost certainly true
podcasts
as
about
well.
therapy are probably way more popular than therapists, and probably if you have a streamer who considers themselves a counselor, probably like Dr. K is probably more popular. Like people are more likely to watch Dr. K than they are to go find their own therapist, and they'll just take the treatments from Dr. K that he gives to other
You're
people.
right. I think Dr. K is I think he's not a good person, and I still watch his stuff because it's interesting. Like, look, I don't want to get into it. We'll be here all day. I'm just saying that like I'm susceptible to the entertainment factor of it. I want to hear why 𝕻𝖎 thinks that he is incapable of cleaning his house.
And if
That's
you relate
interesting.
to 𝕻𝖎 and now he's doing that therapy session with Dr. K, you feel like you're doing that therapy session with Dr. K, and now you're good.
Yeah, especially if you've never had therapy. These kinds of things make people think that this is what therapy is. And that's super dangerous because then you go to see a therapist, like, hey, this isn't like that episode of Dr. K that I just saw that motivated me to come here. Yeah. Well, so there's both sides. There's like when we say therapy culture, medication culture, all these things, there's a culture and there's a counterculture. And I think they're both fucking stupid. We need to meet somewhere in the middle.
There's like medicine, and then there's the culture around medicine. There's no counterculture. There's no counter medicine culture. It's just like there's what actually is.
I don't know about
therapy.
that.
There's
therapy.
Counter
There's
medicine.
therapy.
I think I've addressed these
therapy
things.
culture. So like therapy is the counterculture.
What do you want to call the other movement that's super like, so there's the therapy culture, so super blindly for therapy that everybody needs to go. If he's not going to therapy, he's a red flag. Oh my God, keep him away from me. But then there's the other people who are like, nobody fucking needs therapy. You're just really being a little bitch about it. All right. This is a counter cultural idea to this. And then the medication thing too. Somebody who's like, like I'm not exactly the way that I imagine myself in my head. So obviously I'm not on enough pills. This is the farming extreme of that. And somebody who says, you know, like really, I don't need any fucking medicine. I'm not weak. Okay. I'm not a little bitch.
I misunderstood. Sorry,
yeah. And I think both of these sides are absolutely batshit crazy. We just need to be rational, and we need to guard ourselves from being super susceptible to people that are trying to convince us of things like TikTok. I can't tell you how many people have messaged me like, you know, I think I might be autistic. Like, why? What the fuck? And they're like, well, I seen like a bunch of these TikToks. I'm like, that's me. And it's really weird because some of these things are really, there's some of them are done in a really good way to where I've shown people some of these ADHD ones that help them understand me a bit better. I was like, oh my God, I wish I would have thought to explain this in this
I've
way.
seen that guy.
This
I
is
know what
such a
you're talking
human
about.
way to explain why I'm why I do this thing that drives my wife crazy, and I can show it to her. She's like, oh, I get it. And that's really, really helped her understanding of like some of the stuff that I've gone through. But then again, too, I'm also somebody who's been diagnosed like by every single psychological professional that I've ever been for, like, you have ADHD.
So
like,
I don't think there's
yeah, no
anything wrong
shit.
with. I don't think there's anything wrong with sharing your experiences. And I think I've seen that same guy on TikTok who does the ADHD, who he talks about like how he's dealt, what he deals with his ADHD, and like kind of like a story type.
Oh,
way.
I've seen a couple of people that I thought they do this in a really good way.
Mhm.
They're not sort of like pitching ADHD
Yeah.
as a product to get people to
Exactly.
subscribe to, but a lot
I
of
think
them
it's okay.
do. This is it is a social contagion. It's a mental poison.
What do we think
if-
about the people who are? I'm trying to think of a good term for them, but let me kind of bear with me as I try to explain this correctly. People who will pitch their disability as not a disability. Well, there's nothing actually wrong with having X, Y, or Z. It's just thinking differently. We're the same as you, right? We
Autism is a superpower.
Yes, that kind of
Dude.
thing. I don't even know what to call it, right? Like, do they have a point though?
Delusional.
Like, is the stigma, right, that we give to people who have these conditions, right? Is it something that we should be combating by viewing the autism as a superpower, for example, or do you think that's counterproductive? What do we think? Eh?
I think the idea is that they just don't want to feel less human. So like you hear this from like blind people and like deaf people that what if they don't want to fix their deafness? They don't think there's anything wrong with them being deaf, right? So it's just, I think it's a way to be like, this is an ailment I have, but it doesn't make me less human. I don't know if I want to fight against it necessarily, but like I don't think people should see like, oh, autism is a superpower either.
I think what you said sounds kind of slick, but it's not. It can't be that it might be a response to feeling less human, but nobody's saying they're less human. When they say that I don't want to fix it because there's nothing wrong with me, what they're saying is that I have built an identity around something that is wrong with me. And also, I probably like some of the benefits that I get from having this disability, the way that people do see me as lesser, because people are going to be more willing to help me out. There has to be an incentive for you to want to keep that. Because you're off the incentive for getting rid of your deafness is you can fucking hear. That's a huge thing. Like if you lost your if you lost your eyesight or your ability to hear, tell me you wouldn't do anything to get that back.
Well, I think it
What if you were
depends.
born not able to see or hear? It's kind of more what I was.
Yeah,
maybe
this is
talking
a
about,
topic
but-
on a previous. I think you were there, Ali. Like, and there's a difference between someone like losing their sight and obviously maybe having a strong desire to restore it, as opposed to someone like I'm pretty sure you were there, Ali. Of like, this is a topic of like genetic engineering, and like certain individuals that have lost their sight, not wanting to correct that with genetic engineering, where they have a desire
That's
for
mental
their
illness.
well, yeah, without getting too sidetracked, but like that was the question basically in this panel of like there are some people that for whatever reason, probably through congenital defect, have lost their sight, and then they have a strong desire for their children to also be blind. Now, like there's obviously a question there.
You should. That is a question. If you have a pill, right, that could cure blindness, autism, ADHD, all these, right, in the womb, right? Like you can make the woman take it, and she would take it, and it would guarantee that her child would have none of these things, right? Do you think that it should be mandated that people take these? Mandated, yes.
No, available for all and not just the rich, but not mandated. I don't know.
Why not? Why would we allow someone to be a drain on the system like that for when we could fix it?
I would say yes, but just so that I could know that I'm making decisions about women's bodies and they can't do anything to stop me about it. No, let's be real here. Anybody who's saying no is because they're one of the people that are insane, that are like, well, I just don't trust the pill. Like, we have the data. I'm assuming that we have the data on this.
Yeah, in this hypothetical, it's perfectly safe. There are no other side effects. All it does is cure ADHD,
gonna-
autism, blindness, deafness, any congenital kind of issue.
Yeah, you go,
right?
look,
Heart
you
issues.
QAnon fucking
Makes you healthy.
freak.
Right?
I'm gonna
You don't get to
I'm gonna
abuse your
quote
child.
Admiral Gibbs and say it just sounds like a pretty slippery slope. When if you start with that, I don't know where we get to like, oh, what if you
A slippery slope into what? A better society where these things don't exist? Oh no, we
Well-
might slip into productivity and not being dragged down by preventable disease. What's next? Telling people that they need to get their children vaccinated to go to public schools?
I don't want my kid to deal with racism, so I'm gonna make them white.
That's the example that I brought. I think you were there. You're using my examples.
I don't know if we were on the same.
What
pen.
if
I was trying to think
you're
about that.
in the government, right? And you're in a position where you could put this in the water like fluorine. No one would know, right? At least not at first. And you could do that. Would you push that button to the anti-autism water? Would you let it flow, or would you forbear?
I probably, I don't know for sure, but I probably would not push that button.
Yeah, I probably wouldn't
would-
push the button. I like us just kind of we'll figure it out.
Wait, what about curing cancer?
Push the button.
If you had something where it would cure cancer and make sure no one ever got cancer, they wouldn't have a choice. You would just push a button, and through the water, the anti-cancer would come into the water. Would you push that button?
Even then, like,
No.
I'm coming.
What are
Jesus
you doing?
Christ.
What is going on? What is?
You're a
what are
super
you?
villain.
I am coming. From.
Chill.
Like, so can I?
Yeah,
Get out my position?
Yeah.
I'm coming from the position of like the way I view it is like forcing a medical treatment on a person without them knowing. Of like to so you're using a water example, okay, and that sort of like dilutes.
Fluoride,
I think
like
for
fluoride
me,
in the water. Yeah, that's why I'm using
Yeah,
the
sure.
example, because we do that in
But-
America with fluoride. Right?
yeah, sure. So to bring it back down to like the example that you're giving of like, okay, at an individual level, this is genetic engineering, okay, and that like now you want to correct whatever
No, it's medical
defect that you
prevention.
see.
It's just medical prevention at this point.
Yeah,
It's just a
yeah, it's
pill.
okay. So
Wait, should
whatever-
Superman be in jail for rescuing
Can I
people who
finish
didn't?
Can I finish my point?
I'm
please?
just asking a clarifying question here to see where you're at. Does Superman have to go to jail because maybe these people wanted to be mugged or shot? Is it just because we're in the field of like the realm of medicine that you can't force the obvious best choice onto somebody? I don't understand. This is what I need clarification on. Is there something sacred about
Okay.
medical field?
If you're, yeah, I think there is.
Okay.
So there might be a fundamental disagreement. That's why I'm going to try to use the example to tease out where our boundaries lie. Of like, okay, this genetic engineering technology is like now whatever the next 5-10 years, okay? And we're using the blindness example, okay? And through genetic screening, okay, they find out that the child that they're carrying is going to be blind, but we have the technology to correct it. Would you force that treatment on that this pregnant person, or on the fetus? Okay,
Yes.
We already don't do that.
and I
would say
wouldn't.
somebody who
Jehovah's
isn't
Witnesses
willing to
can't
take
blood
it is
transfusion.
unfit to be a mother.
Jehovah's Witnesses who don't.
Well,
have
that's a
blood
separate
transfusions
question,
can't force a
okay, and
treatment
that
on
might be
someone.
valid. But like, yeah, I would not like strap them down, even if it's a pill. I would not like force feed that pill to them. I would not put it in their IV, whatever way it is.
Sure. Then here's the choice. You take this pill where we cure your child of these preventable diseases, you fucking psychopath, or you take the abortion pill. Pick one. Because this one, if you don't take this one, this means you're not taking care of your child already. It's not even here and you're abusing the fuck
slippery
out of it.
slope, that slope we were talking about.
So yeah,
Yeah,
that
that slippery
is-
slope upwards.
That's a fundamental disagreement of like, I would not force the medical treatment on it, just as I wouldn't force the fluoridated water unknowingly on the population. So that's why I want
Fluoridated water, I'm with you. I think that the fluoride water, like the potential downside, this pill was said to have no downsides. Fluoridated
Yeah,
water
in the hypothetical-
has negative side
Sure.
effects.
What about
But
blood
in the
transfusions?
hypothetical,
Jehovah's
this
Witnesses. then?
drug has no side effect, right? No negatives.
No, for Jehovah's Witnesses, let them ignore every medical technology that exists. Let them die out in obscurity. They're like, if you're a whole group of people that are going to deny these things, then like the problem's going to solve itself, right?
Okay, well, I'm not a fan of any religion whatsoever, but like, I'm not.
Well, no, I'm just saying, like, in terms of like forcing medical treatments onto people or onto people's kids, Jehovah's Witnesses don't believe they can't do blood transfusions and will deny blood transfusions or anything in regards to that, I'm not sure how they are on vaccines or anything like that. But I know the blood
Yeah, I don't
transfusion thing, and so like you want to force it onto them or just exclude them because you don't like them.
I think people's religious views when it comes to medicine get accepted up to a certain point. If somebody's child gets shot and they say, hey, you can't give my kid blood transfusion, get this mother out of here. We're giving the kid a blood transfusion. I don't give a fuck. A mom is not allowed on religious grounds to say, kill my kid. If a doctor is going to ignore their Hippocratic oath and watch this kid bleed out because they're not respecting their mother's religious beliefs, this doctor is committing a crime. Okay, they're letting a child die, and I don't care what the law says. I'm saying it's a crime.
Well, yeah,
It's a crime against humanity.
Okay, this
Okay?
is going to like get into abortion of like, yeah, where does like, so that's why, yeah, the genetic engineering and like, you know, genetically modifying a zygote, okay, versus genetically modifying like, you know, where personhood begins for some people. Like, yeah, I'm on the same page as you of like, bad parents exist. I'm like, yeah, if a parent is denying a life-saving treatment for their child, even in the form of a blood transfusion, like, yeah, and I think there are a couple of few documented cases in Canada of like, yeah, the courts have stepped in saying, hey, you cannot deny this blood transfusion to your child on the grounds of being a Jehovah's Witness. But yeah, for me, it's different since
Good.
I don't view a zygote as a person, and so like for me, the mother, consent of the mother or the actual person that I recognize is more important there.
All I'm saying is that if there was a button I could push, and everyone in the world, whether they be in the womb or out of the womb, right? Whether they be old or young, whether they want it or not, would be no longer blind. I'm pushing that button. I'm slapping it as soon as I can. Boom, 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 boom.
So brave.
Same with cancer, right? If I could push a button and make sure that everyone who currently has cancer, whether they want to be cured or not, I'm pushing the button. I'm slapping that shit. Why would you not? Why would you allow, right, suffering, right, and someone to needlessly, especially with a child, right? A child who has no, like, they don't know, right? They don't know what it is, right? They don't know what they're doing. If you can make it so that they don't have to go through a life debilitating illness, right? One that will keep them not in the same way as race will, right? That's a real thing, but it's a different scope, right? A different scope of disability, right? And I don't even know if I want to use the word disability.
That was weird, yeah.
Yeah, don't know if I want to use the word disability there, right? But a different scope of a debilitation. Let's say that. Yeah, blindness ain't the same as being white or black. It's just not. Let's not play pretend here.
Just interestingly though, saying the pill to make them white so they wouldn't suffer racism is kind of goofy. What if you could press a button and make everybody some new race so to eliminate racism? It's not, nobody's white, nobody's black, no Chinese, Asian, Mexican, none of this. It's just a totally new thing, and we're all the same. Boom, no more racism. Does that change the hypothetical? Because I feel like saying white makes it like ridiculously unnecessarily charged.
So the thing with the hypothetical is that like in the hypothetical everything is going to work perfectly. What ends up happening if you actually allow like the genetic modification is you get elysium, which was like that ring around Earth where all the rich people lived and all the broke people, all the broke people there. So the rich people had a machine they could wake up, they'd lie in this bed, it would reconfigure their fucking DNA, and they wouldn't have anything anymore, right? That's what actually ends up happening. So like in your hypothetical where everyone in the world gets the same treatment, we all don't have cancer, and we all live in utopia, based, I'm with you. But we know that's what I mean by slippery slope. It's just that's not how that shit goes, and so like that's why I'm opposed to it. Like not because I'm like an evil person who wants people to be blind.
Elysium's a metaphor for what actually exists right now, though. And also, when it comes to genetic modification, we live in an insanely genetically modified society. We eat bananas that were genetically modified as fuck so that they're edible to us. Like, most of our food is genetically modified in some way.
And now we're not allowed to, like,
or at least
grow them because
chemically
Monsanto
modified.
and now Monsanto owns the seeds, and we can't grow the
You can still get heritage seeds if you want to.
I mean, but eventually we get to a point where we can't.
Okay.
That's the slope, right?
Okay. I know some of you have to go at 8. Mm-hmm. And I know some people want in on this discussion. So how about we do this? I'll give you guys closing statements, and then I'll open it up for call-ins. And if you have thoughts on this, right, on either therapy culture or Curing blindness.
Yeah, I was gonna say, you want closing statements on eugenics or therapy culture? Because we covered a lot of ground.
I know.
Here.
Oh
but
my god.
I think we're because I think we're sticking on the eugenics thing because this idea that like if your kid had cancer or your kid had blindness, if your kid was blind, there's any world where you wouldn't, if you could just make them take a pill to not be blind anymore, that you would. Yeah, that's wild to me. Anyway, closing statements. Go ahead, Corey, and we'll go around and we'll.
You closing statements on both? Okay.
Well, whatever you want to do, man. Your choice.
Okay. Yeah. Well, I think we just briefly touched upon, the genetics and anatomical, but yeah, I think there's a very interesting, well, maybe potentially interesting conversation to be had there. But yeah, eugenics, complicated. I don't think really people fully understand the implications of, let's say, how it will work somewhere down the line. But to return to the topic of therapy culture, yeah, I think pretty much it can be hopefully nicely summed up of we covered a lot of the negatives of some of the negatives of this increased pervasiveness of therapy culture. I think that there's valid criticisms there, but I think overall a net good, just as raising awareness and to the example that was brought up of social media and the social contagion. I agree that might be an issue, but then I think it needs to be balanced out of well, what if this increased awareness is allowing people to get diagnosed where they actually need the valid diagnosis it's bringing to their attention of, okay, maybe I should actually be screened for this, and now they're getting the actual appropriate treatment. So cost benefit analysis, there might be people that are taking on the label or trying to diagnose themselves with these conditions unnecessarily, but then at the same time I'm sure there's some group of people that are I'm now aware of this and I'm actually getting appropriate treatment, and hopefully my quality of life is improving. But yeah, this is great as always. Super appreciate it. You can find me on Twitch, Corey Campbell 84, Twitter, X, Instagram, YouTube. It's Corey Campbell. Always a pleasure, Wick.
Well, I always like having you. Thank you for coming on. I really appreciate the discussion, and hopefully in the call-ins it's equally robust. This was fun. 𝕵𝖓, go ahead.
I think that saying eugenics calling this stuff eugenics really only serves to remind people of the Holocaust and stuff. It freaks people out, but at the end of the day, eugenics isn't necessarily a super bad thing. There's things that we do that eliminate traits all the time. There's just obviously good things that we can do to benefit society. And if we're not going to do them because we use scary words, stop using the fucking scary words to talk about them. Let's just deal with the reality of the situation. Same thing with the different cultural aspects of therapy, with medicine. People are just being either way too invested or way too freaked out. And we all need to step back and actually look at what we're talking about and stop being so fucking full of ourselves and thinking that we know everything all the time, I think, and just take a realistic, philanthropic approach to these issues. And I think the world would be a better place for it.
Where can people find you?
𝕵𝖓 on YouTube, on Twitch, Kick, and Twitter. And I'm streaming a lot now. We had a lot of people showing up. It's been really fun. You should check it out.
Do so, gang. 𝕵𝖓, he's great. Even when I substantively disagree with him, he's fun to talk to. Go check him out, gang. Hit that like button, hit that subscribe button on his channel. He's great. Last but certainly not least, Ali, go ahead.
Yeah. Cultures are about vibes, not facts. So it's fine to have cultures, but don't take your information from them. Most of you need therapy. A lot of you don't. So just go with that. Stop looking up definitions for words and just using them because it helps you project whatever insecurities you have onto the world. It's not helping. It's not good. If you think everyone needs therapy, just you go to therapy and you'll find someone who's in therapy and everything will be okay. But other than that, I changed the name. It's sociologic_Ali's because Arab names are hard to say in English and look up. So that one's easier. They're all white words. So enjoy that. And thanks for having me on, Wick. I really appreciate it.
White words. No, thank you. Sociologic Ali. Check him out, gang. He's great. We love to have him. And gang, if you want part of this discussion, we're opening it up. So if you want to be in this discussion, if you have thoughts on apparently eugenics or curing cancer and whether or not we should cure cancer, Call in, !Discord, click the link, accept the rules, jump backstage. I'll pull you in and we'll have a discussion about it. But that's I want to hear the argument against curing blindness. Or deafness even. I'm just really curious.
So I can't speak for that community, but that's why it's like I
don't worry,
know
they can't hear you, right?
But
like the deaf community, at least they won't hear you. You're good. Continue.
But I think if you asked every single deaf or blind person on the planet saying, "Hey, do you want to cure your blindness? Tomorrow with this no side effect treatment," I think there will be a subpopulation that would say no, they would reject it. And
Do you
I
think
would
that's
respect
a mental?
that.
You don't think that that's a sign of severe mental illness?
No.
I'm not qualified to make that diagnosis.
I asked what you think. I didn't ask you to make a diagnosis. I said, what do you think?
had
to take
no,
a
I don't
guess.
think it's a mental illness. If someone doesn't want to have their sight restored, their hearing restored, like I would respect that choice. I would not
Fucker,
make.
you need therapy.
Sure, that's also possible.
But what about their? I understand for an adult. Like I understand for like someone who's like 40 years old or 30 years old even. But if a child, right? If it's for their child, they're having a child. We know 100% that they are going to be born blind. Okay, they're going to be born blind. We don't even have to do an invasive procedure, right? We could just here's a pill, take the pill. Your child will no longer be blind. Nothing else will change about them. They'll no longer be blind. You would not mandate that?
Make it less invasive. It's an aromatherapy candle that will cure their blindness. They don't even have to ingest anything.
More now.
Yeah. Even if it's an aromatherapy, well, yeah. Like if you're saying that you just sneak it in, to me that doesn't make it any better. Of like,
no. They have to consent still. I'm not trying to take that part away from WhickTV thing. I'm saying they don't have to take a pill, a super scary pill.
I'm going to side with Corey on this. There's a concept called informed consent, and the child should have informed consent.
The child isn't born yet. The child's in the womb.
I understand,
Yeah.
but some people still believe that that child should choose things for itself, because otherwise the argument would not meet up well with abortion advocates, and saying that, well, we should think of the child. Well, the child isn't really an entity, so why should we care about it? It doesn't work right.
We're assuming the child's going to be born, though.
Yeah, well.
Who cares if the child's going to be born if it's going to get aborted? That's not a relevant objection.
If we're going to care about the child while it's in the womb, we gotta believe that it is an entity in and of itself that should be fixed.
We're only caring about the child in the womb in this scenario insofar as understanding that it is going to be born. It is going to be a human being that is going to end up being blind. So to prevent that, WhickTV has proposed a pill or maybe an aromatherapy candle that you don't even have to take. You can just smell it, and this child isn't going to be born blind. So what you're saying isn't compatible here. It doesn't matter how you feel about an embryo. We're talking about treating the child just in advance.
So to be clear, I would say you should give it the medication, because why the fuck would you allow a child to be born blind?
Yes. Well, that's the question, right?
Wait, can I ask
there's a informed consent argument, but you shouldn't just inflict a preventable ailment upon a child. I don't know why I would even want that. Go ahead. Sorry.
So let's just say, I don't know if this actually will ever happen, but let's say we get these technologies that are all at home, of at home testing, okay? And then as soon as as soon as conception happens, you can answer the question of through genetic screening, pretty much from day one, will my child, be born blind? And then now we have, plan B. Would you then, if they do that at-home testing, and they answer yes, through genetic screening, this zygote will develop into a blind child, is it then mandated that they must take plan B?
So that'd be a Gattaca argument.
Are you talking about plan B like an abortion, or is plan B?
Yeah, well, the next step of plan B of I can just expel the zygote pretty much overnight.
That's a fundamentally different thing. And no, that would be.
But to be fair, people with Planned Parenthood do this anyways if they're expecting a male or female.
Totally.
They do that nowadays. They for arbitrary reasons.
Okay, I am pro-choice, but I think it's immoral, right? To choose for arbitrary reasons to abort your child.
But I know where Corey's getting the argument from. There is a older movie called Gattaca that you can watch.
Yeah.
It's a
where
good
it's
movie.
screen.
Yeah.
It is. I love the TV screens being in a hyper advanced civilization, but their screens are all shit.
Look, don't worry about it. Look,
Yeah,
it was a
but
cool space show.
it comes down to is it for the good of society versus is it for the good of the personal choice of that person and removing their free will?
Well,
That is what it's coming
in
down to.
Gattaca, one of the issues that they had were people refusing to treat their child, and so their child ended up having a less good life, right?
Oh no! In Gattaca, they were just saying, well, you can give a birth normally and you'll have these defects, or you can screen out all of the possible fertilized eggs to have a perfect child that has 6 fingers on each hand that could be playing a piano marvelously.
Either go through the treatment that would help you or not, right? And it's been a while since I saw the movie, so maybe I'm getting a little the details
Pretty old
wrong.
from the 90s, I think.
Yeah.
Right, but the question here is to Corey's hypothetical. There's a fundamental difference between curing someone's blindness with a pill versus aborting them with a pill, right? It's not the same. Like this idea that this child would not be the same child if they weren't blind, I think is fundamentally flawed. They would have different experiences, certainly, but they would nothing about their fundamental self would change.
Yeah,
in
Here's
any way.
the test.
I can
If we
modify
wouldn't
it.
cure something, and if somebody were to inflict upon themselves the ailment, if almost everybody would say they must be stopped, well, I don't respect your personal opinion about this. If somebody's going to blind themselves, almost everybody would say you're not allowed to do that. Somebody should step in and stop you. If you're in a situation where if you inflict that upon yourself, everybody almost is going to say we should stop you from doing it, then yes, we can force the prevention onto you. We can force the cure onto you. I think that's the best metric to go by.
So,
right?
Okay. Just then further clarify your position, Wick, so I can modify my hypothetical of they have the still the at-home genetic screening. They can answer it, pretty much from day one, whether this child, let's say, will be blind, to use your example. But instead of plan B, they now have right next to them in pill form, the corrective, genetic therapy.
Yes.
So if this is all at home, from day one, so once they answer that question, yes, through genetic screening of yes, this child will be born blind if it continues to develop, they are mandated to take the therapy then, right then and there?
Yeah. As long as there's assuming no side effects, yeah.
Okay, that is a fundamental difference. I would not mandate it. You're now obligated to take this pill.
So would you let someone take a pill that purposely blinded their child in the womb? If they wanted.
Yeah, that's why I think this genetic engineering, I guess to use the less charged language that WhickTV wants, is a really tricky thing of customized babies, to use the example again that Ali brought of modifying skin color. I don't know how to answer that question of if someone wants, there totally would be, I'm sure, a subset
they're
of people.
Deaf. Their parents were deaf. They have a very strong connection to being deaf and looking and
this is literally a panel topic.
Hearing the word, right? Hearing the world through the ears of a deaf person, right? Like being deaf. And so their child, they screen it, it's not going to be deaf, but they want their child to be deaf, right? So they're going to take a pill, non-invasive, no other side effects. The child will also be deaf. You would allow that?
That's why I'm not in favor of genetic engineering. I would not allow.
So to be clear, you would say no. You would not allow a parent to take a pill that purposely made their child deaf.
Probably not.
Okay.
So would you also not allow them to take the pill to cure those diseases? I understand you not wanting to force them.
I would make it permissible. That's the difference of I would not
you're
make
full of shit. Your premise isn't I'm against genetic engineering.
Yeah,
if you can't use that on one end and then say that it's okay if they choose it, you're fine with genetic engineering. It's just that when we're trying to force them and you think it's bad, then you can call on it. But you're actually okay with the thing.
He's against compelled.
He's against mandating.
Yeah. He's against compulsion. That's one of the. It's a liberal argument. The state shouldn't force you upon you to do something that like a medical intervention.
Like,
But-
okay, so like, okay,
To
something
be
my
clear,
brothers brought up.
I'll let you go in a second, Ali. But to clarify a little bit, Artemis, we're not talking about doing it for themselves or to themselves. We're talking about doing it to their child.
See,
or
the answer
allowing it
is
to
that
happen.
Yeah,
the
so-
same argument that was stated with My Body, My Choice is going to come into play here, where you cannot force a woman to make a medical procedure against their will.
Okay.
Like, that was the whole premise.
Just
of My Body,
just
My
to
Choice.
to
I have-
catch. I'll get you in a second. Just to catch
I don't
Arena
believe in.
up.
I don't believe in that.
Our conversation has transitioned to apparently, would you force a woman to take a pill? Say the woman finds out that their child's going to be born deaf or blind. Would you force or mandate that woman take a pill? No other side effects. All it would do was make sure that the baby was going to be born able to see and able to hear.
No.
No. Okay, well that's the discussion. Go ahead, Ollie.
What if it was?
Wait,
what
wait,
if it was a
so
candle
wait.
you just had to sniff? This gets rid of the
I
stupid
can- what
my
if-
body, my choice thing.
All right,
It
what
gets
about-
rid
what
of
about in a
saying
world-
it's against my diet.
What about in a world where Neuralink has been implemented? People have Neuralink. Your baby, you could choose to give your baby Neuralink because it'll have it'll be with the advantaged people versus just having like what would you say that needs to be mandated because we have Neuralink?
Nope.
Why? Wouldn't it be the same thing? You're
No,
having
not at all.
It's a
Because in
debilitated
one
life with
case-
less advantage.
In one case, what you're doing is you're either in the case of people taking the pills to make their baby deaf, versus people taking pills to or refusing to take a pill to cure the deafness of their baby. What you're doing is you're putting your child at a substantive back step from the norm, that the baseline, right? A Neuralink is an improvement, right?
Yeah, what
it's
if that
a
becomes the
it's a
baseline?
jump forward
Neuralink-
from the
What if
baseline.
that
There's a
becomes the
substantive
baseline?
difference here.
Everybody
it
that gets
becomes the
Neuralink
baseline and
chooses
your
to get it, though.
I
Here's
know,
the
but
thing:
if it-
there's a
I-
choice
it's
to be
bec-
made to get it. That's
I
the
know.
difference here. Is
But
that
in
you
a
can say, "I'm
world
going to
where-
choose to do this, and I
Yeah.
want this thing in my brain." Whereas nobody, if somebody says, "I'm going to choose to blind myself," you go, "The fuck you are!" Somebody grab him, hold him down.
there's-
Let's
there's
get
an
him to the
improvement.
fucking nut house.
I want to
There's
step
something
in
wrong
on
with
this.
this
What I'm
guy.
saying is, if there's a baseline, if everyone, if it became that the majority of people were on Neuralink and you were at a disadvantage if you weren't on it, and there are people who were against it because they were just anti-technology and anti-advancement in these types of ways, right? Your argument is saying that these people should be mandated to have their kids eventually Neuralinked because that is the baseline, that is the norm, and you're putting your child at a disadvantage.
I think we have to leave it up to those people to have that argument because they're going to have different minds than us, and they're going to have different values, different culture, and they'll be able to think things through differently.
So no mandate. So that's
Okay,
it.
hold on,
The
I got
problem is
a
no
question
mandate.
I'm
here.
saying we can't discuss this in a meaningful way because
Why?
it's just because we're talking about how people are going to think and discuss things are going to be significantly different because their brains are improved with computer technology. They're going to have a better understanding of all these things than we will, and that's going to
Right.
be a much
different
world than this world.
Yeah.
There's an easier
Okay,
way.
a few people went in. Here. I want to give people a chance to say infallible foul.
Sorry.
I'm going to toss the ball.
We
to
have
you
way
first.
too many fouls here in
And
this
we have
Discord.
a lot of fouls. Okay, infallible foul gets the ball first. Then we're going to the arena, and then we're going to go to Artemis foul. That's the order we're going to go in. Infallible foul. Go ahead.
Well, there's a lot easier way to look at this. If you look at babies that come out and they need to be on a breathing machine, you get to choose whether to put them on that or not.
The parents do, I believe. Oh well,
No, they don't.
You can say,
Well,
"No,
yeah.
you-
well,
you just-
well. So
breathe
yeah,
on their own, it's fine.
if it's life saving, yeah, like yes, if it's life saving, I sorry, I want to clarify. Yeah, I understand life saving. Well, yeah, this is gonna go. When does personhood begin? So
To be clear,
talk
Corey,
about
you're
slippery
correct.
slopes.
It is the parents' choice. They have many examples of the baby has a very small chance of living, especially ones that are born way premature, and they are put on those breathing machines. But the parents do have it during those gray areas of having the choice of whether or not to put the baby through suffering if it's not guaranteed they're going to live.
Yes, but there's a gray
that's just-
area there. It might or might not work. That's a different story than what question we're asking. Is
Sure.
this is definitely going to work? There are definitely not going to be side effects if you don't do this. This person is going to be disabled, right?
Mhm.
And in the sense they were going to be unable to see and unable to hear for the rest of their life, and we cannot reverse that, right?
Sure.
We have a limited period of time. We have to make this decision, right?
Mhm.
And to choose not to do that, to choose not to cure your child is
Uh-huh.
immoral. It is wrong, and it, dare I say, selfish and evil.
So how do you force them
Evil.
to do it?
I was going to say, I think having children is inherently selfish. I do think that that would be an immoral choice, but we have a right to, I don't think legally mandating it is ethical. I do think it would be immoral not to take the pill, but I also think that the government coming in and telling us what to do with our own genetic material is more of a problem than that.
No shit, Tuna Chip
personally.
is here. My bad. I didn't expect the antinatalist take. Wick's right. Everybody who's saying no to this, you're literally like a supervillain without the power. I don't fucking understand. Like, Corey, your world, like, I don't understand how you can make these claims and then say it's not okay for somebody to beat the shit out of their kid. Like, this is the
I have very
craziest world
strong
you're constructing.
stances on corporal punishment.
But okay,
It's
so
very
are you saying
complicated.
if there's a world where you can have, let's say you can snap your fingers, and instead of an abortion, a woman's fetus gets put into an artificial womb incubator and becomes a ward of the state, is that what we prefer?
That's
for me,
significant. That's significantly more complicated because now people can make the argument. See, this is why I even went with the candle. We're getting rid of the unnecessary, crazy arguments that come up. When it becomes a ward of the state, you go, okay, well then, what does that mean? How do I feel about the government raising a child or making the decisions for the child? Could the government do all, like, it's just a bunch of extra nonsense. But like,
No, I think they're highlighting the forced medical intervention of, like, if we now have the technology, access to technology of, like, at any stage of pregnancy from conception to birth.
The implications are different here, though.
So
I think the
But either
ability
way, you're
for
told what to do with your genetic material before you've birthed. And as somebody who has the potential to give birth, I would very much like for there not to be government mandates telling me what to do with my uterus and my genetic material.
In this specific instance, it is your baby is objectively safer, healthier, better by every metric. And there's the assumption in this hypothetical that you are choosing to have the baby.
I
So
think
there
all
is
these
only
race, skin color
upsides.
arguments fits all that
my
criteria.
Neuralink argument fits as well. It's just the same. It's the same thing. If the people you're putting your baby at a disadvantage if they're not. If they like the rest of the world is like it's a choice. It's the same exact thing.
The Wick example is objectively better. Making the baby
Sure.
a ward of the state brings in new variables that are not that they change this
They have the
objectivity.
best life ever. It doesn't matter. That's not the point. The point is specifically that there is now legal mandates telling you what you can and can't do with your own genetics.
What is the best life?
If somebody steals somebody's sperm, I believe that to be a reproductive violation. If somebody steals somebody's eggs, or like that doctor that like used his own sperm in IVF or whatever, that is a reproductive or maybe even like a sexual assault. I don't know if that would be accurate, but it's a reproductive
maybe none of
assault.
this is the same though.
But
This
it is
saying,
because you are being told to change your genetic material, yes, for objectively better. But I've also heard some
we're talking about
disability activists
saving
say
a
that
child's health.
that their lives are worth living as nature intended. So there's also that way to look at it.
If you know your baby is going to be born
Nature
with
doesn't
4 arms,
intend
no
anything.
eyes.
No, hold on,
And-
real quick. Nate,
Well, I would
let's
abort at
address
that
this.
point.
There is no intention. Like, nature isn't alive, right? It doesn't have a will. It doesn't have a decision-making
A metaphorical
capability.
intention.
There is no intention
right?
here, right? So again, like, if I'm not advocating that these people be killed, that would be horrific. What I'm advocating for is that if it ever came into play, where we could put this in the water, right? Where we could just put it like fluoride, right? And so pregnant women who drink the water, whether they know it or not, right, their babies will be healthy. They won't have blindness, they won't have deafness, and these things will be cured. I think that's something we should do as a society.
What if the medication was, or the thing that was,
if it's got side effects,
imperceptible?
then
Hold on.
That's
What if
what
it's
Neuralink is. Neuralink is just putting
on.
it in the water. It's the same thing. Your baby
Hold-
won't be
hold
blind.
on.
They won't be sick. They'll be smarter. They'll be better. It's just putting all the benefits in the water
Hold-
versus
hold-
just
You're
the
assuming
blindness.
too much about Neuralink.
Okay,
You didn't
here's
build out your hypothetical well enough. You didn't build it out good enough.
It's not like
hold on.
Jeez.
What if you had an imperceptible, undetectable, like that has no negative side effects, and it makes you non-religious, non-racist, agreeable, charitable, all the good things in life, would you force it upon everybody?
No, that's a substantively different thing.
Yeah, that's
Why?
too. That's
Because
you're interacting with way more values.
yeah, like we're
Well,
talking
we're
about
still
the
in the
ability
magical
to
realm
perceive the
of
world, right,
betterment,
as a
yeah.
baseline can, right?
Mhm.
So the baseline of being able to see or being able to hear in these cases,
Okay.
right? That is a fundamentally different thing than changing someone's thoughts, which is what
Yes.
would be
Well, they never
for
had any
anti-racism or anti any of these things, right?
Well, you did,
That's
well,
a
they didn't
very
have thoughts to
different
begin with.
thing.
They never had thoughts to begin with.
You're just preventing those thoughts from ever occurring.
Yeah, that's a
Well-
fundamentally different thing than making sure that someone has the capability of seeing and hearing.
What do you mean?
Thoughts and these ways of thinking are a fundamentally different concept than the senses.
The things that you're talking about are values that have reasonable conflicts and disagreements with people that are pro and against it. We would say that anybody who is pro blindness is fucking crazy.
So,
Like
so how,
anybody who says I want a blind child, you go, there's 99% of people go, no, you do you should
But
not be able to take
the-
steps to make your child
Absolutely.
blind.
Do you know about
this
the
is
deaf
wrong.
community?
But they're
like as a culture, like deaf culture,
This was
they very much
literally the panel
view-
topic.
Yeah.
Oh, yeah.
People develop a deaf culture out of necessity of being deaf and needing.
But they're also
a-
anti-cochlear implants.
Yeah, sure.
So
That's
they-
fine.
Yeah,
they
they're wrong
argue
for that though.
their
Like that's the
culture
thing.
is
That
worth
that
keeping.
culture is
That's a cope.
wrong.
So here's my big issue, right? For the thing that can cure blindness and the thing that can make you a better person, there is no argument you can make for one to give the power to the state to cure blindness or any medical issue and not have the power also be given to the state to fix all the other stuff. You're just giving the power to the state to
Yes, there
choose what is like what.
What you're talking about is, can we fix something that everybody agrees is a problem? Blindness,
Racism
Not everyone does.
deafness.
Like that is the fundamental.
No,
not everyone
we
does.
don't. Not everybody agrees that racism is a problem. Some people are like, there are fucking different. There's race realists out there. You can't just say that. This is something that if humanity doesn't fix on its own, they're just going to substitute race, or they're just going to substitute some other difference to focus their lizard brain rage on.
I'll
these
address.
are
I will.
idealistic
Okay, sure. I will address. So, hot take. I am against racism. Okay, but let's just say
What?
it boiled down.
How brave.
Whoa,
Let's just say.
careful, TLS, brother.
Let's just say it boiled down like we found the racist gene. Okay. Okay, and so you can screen of like, am I gonna have a racist child? Would you mandate that genetic therapy? Because I would not, personally.
Good.
No.
Anybody
I
want to
don't
answer
think it
that?
fixes the I don't think it fixes the problem. I
Okay.
think that racism is generally going to be something
It
that
did fix the
if you
problem.
take
But
it, if you take
hypothetically,
it,
if it did, would you?
Okay, that's what.
See, this is what I'm trying to say though. It'll
Wait,
fix
but you
the problem
just
of
said because
it'll fix the problem of racism, but there's no part of my understanding of how this works that it's not going to then just map onto something different.
Okay, good. So now
It's
we have
something
this.
that has to be fixed at a broader societal level. I do not believe that there's a genetic component
you can
that could
you
just
can
be
say
changed.
you
for
can
it.
say the same. You can almost say the same thing about blindness or deafness. We can accommodate them.
No,
we have
you
the
can't.
technology. You can.
I'm
We
sa-
can't.
I'm saying that you can fix blindness and all of the problems associated with blindness go away when you fix it. There is nothing that we need to do as a society that would be better than just saying, hey, you can see now.
Okay.
This
so
would
here,
objectively be better. There's no negative side effect that happens from having sight. that would say,
I'm
blindness is
curious.
better.
I'm curious, Wick. You don't have to answer, but would you mandate the correction, the genetic correction for racism if it was rooted in genes?
If there were no negative side effects and it just got rid of racism as we understand it to be in a negative sense, yes, obviously.
That's
So
fun.
here-
Yeah, I would not.
so here's
I don't
here's-
agree with you building it out that
this
way.
is
By
this
the
is
way,
a problem here, and let me kind of clarify here. I don't think that like racism is a gene, but blindness.
No, I'm not. I don't think it
is,
is either.
right?
But,
And
So
that's the
here's-
difference here. Blindness and deafness are
Mhm.
something that is in our genes that we could hopefully, right, one day fix, right? Racism isn't that.
So here's
Okay,
my,
well,
here's
so
my...
that's sorry, I'll let you go, Arnold.
Yeah,
But
yeah, go
that
ahead.
directly speaks to Eldridge because he's comparing blindness to racism. Everyone agrees
No,
that
I'm
blindness
not.
is bad. But why did you bring up racism to begin with? Of like,
I did.
Somebody
I
else's
did.
hypothetical.
Yeah,
okay,
it's
okay,
my
then I
hypothetical.
apologize. I
Yeah,
apologize.
okay.
I retract everything.
So
Good.
I'm gonna
Total
break it. So
Wick
I'm
victory.
gonna,
Anyway, go on, Artemis Fowl.
I'm gonna. This is the culmination point where I was dragging everybody here too. So, if that's the case, where a certifiable medical issue is there, blindness, let's just say schizophrenia, stuff like that, you can identify it in the womb. Okay. Or a value of racism, whatever, like mental value that you would have as you were an adult. It could be cured on either way. Which one does trans identity fall into? And would you fix it?
I wouldn't fix it because I don't care if people want to be trans.
But that's a medical issue. That is a thing that can be cured medically, right?
No, saying something can be cured medically doesn't necessarily make it a medical issue. If you said we could give everybody a pill and they're no longer into anime, I wouldn't call this a medical issue.
But
Hold on, Jenny.
Hang
Go
on.
ahead.
One breath say I would give you a
Oh, your
pill to cure
mic is
blindness.
just not working.
so,
Can people hear her?
no,
I know it's cutting out.
So
severely.
to be clear, everybody's
Oh, that's
everybody should be in
unfortunate.
agreement that being trans is a genetic issue, right?
I don't think that's how
No.
it works. No.
No.
It could be. I don't
It's
know.
not.
I
If
just
it's
don't
a-
know enough about it.
So what causes it?
Wait, we're conflating purely physiological things with things that are now entering into the realm of ideas and emotionality and values, all coming together to create an effect. Being blind means my fucking eyes don't work. Full stop. That's all that it means. If I'm racist, there are layers and layers of different things that are creating this feeling in me. And then how I behave and externalize it has negative effects for people, sure. But my eyes not working, on, off. Ears not working, on, off. It's that simple. There's no downstream effect here that like causes all kinds of weird things.
Well, now I have to
that we
hear
don't
your
fully
dumb
understand.
ass.
We
That's
fully
a downstream
understand.
effect.
But schizophrenia is your brain not working, but you can hear and see things, right?
Well, I was addressing like the racism and all these things. I think
Oh, okay,
schizophrenia is a
wait.
much more interesting thing to talk about.
Yeah, sure.
To be clear.
That's stupid. If you could cure stupid.
Yeah.
Yes, if I could put in the water where people would be more wise, smarter, just more intelligent overall. It wouldn't change it wouldn't change what they ended up thinking, but it would improve their ability to do so. Yes, I would absolutely put that in the water. Why would I not?
Okay.
If there was a glove that happened to be like jeweled that has some stones in it, and you snap it, it will do the same effect. Would you snap it?
Would I snap it? I would Thanos snap that into existence. What I wouldn't do is Thanos snap stupid people out of existence. People who are currently like, who else would be on my panels, right? I wouldn't have no more guests. If I had to get rid of. This is the difference here that we're talking about, right? I'm not talking about getting rid of anyone that currently exists. What I am doing is I'm saying that in the future, right? I want people to be better, to be smarter.
Isn't that saying you don't want them to exist?
Oh, I'm curious.
Eventually.
What's
You don't want
your
blind people to exist, so you want to eliminate
what's your IQ cutoff, Wick? I'm super curious. If you want to give a
I
numerical
want better
value.
wages for workers because I hate poor people. That's not how this
Yeah,
works.
am I
But they
genocide? Am
are-
I eugenicsing poorness out of existence by giving everyone a living wage?
There is a argument among that I've seen among the some of the disability activist communities
Yeah.
that selective abortion is ableist and that it is an act of genocide.
Correct.
So, but I still do believe that you have the right to getting
There
an
is an
abortion for
argument
whatever
there.
reason.
But it's not equivalent to what Wick's talking about.
But
Sort
It's
of.
you-
hypothetical.
Sort of. So
No,
if you,
They
so
still
if
get to
you're-
be born.
Well,
Just
no.
better.
Yeah. So what if we had a pill that could magically turn trans people into just normal people?
This is a style
reject
of
that
being.
language,
This is
but
a
okay.
flavor of
Well,
existence here. Okay,
Norm,
this is something
normative
that-
being the norm, right? It's a norm.
You're talking about altering somebody's identification, which is not the same as altering somebody's ability to access their senses so that they can have
Well,
an
They don't
identity
have-
that's
they don't
informed
have
by all their
dysphoria-
senses.
They don't have dysphoria anymore. They don't have the depression anymore. They don't have the debilitating ailments that
Yeah,
come with it.
it's a medical thing.
Not everybody that is trans has gender dysphoria. Not
That's
everybody who's
Wait.
trans hates themselves and is depressed. There's some people that are trans that absolutely
Okay,
love
I'm
themselves.
just
They have
letting
no
you guys
gender
know
dysphoria.
we have 5 minutes, and then I'm cutting this off because I want to go do some things.
I just wanted to point out that there was going to be a cognitive dissonance in the conversation with this topic. That's why I wanted to bring that up. But accomplishing my goal, I'm going to head out so that way you don't get your video
And
taken
remember
down.
to give me money as you do so.
I
But
will.
thank you, Artemis. I
Don't
do
back down,
appreciate
Corey.
your
Keep fighting.
yeah, I do appreciate your perspective.
Yeah.
So thank you. Jenny, let's try your mic again.
Hi, Jenny.
Is this better?
Just
A little
quiet.
bit, I think. Just it's a volume issue.
Yeah, at this
Let me
point,
turn her up.
hold on.
Okay. Is that better?
Yes.
That seems much better.
Go.
Okay. So my thing here is you guys are all coming from the point where all disabilities are inherently a burden, period, the end, nothing else.
Not
Stop
me.
shaking your head like yes.
Not all
Yes.
of them. Blindness and deafness for sure, though.
blindness and deafness, and they also have accommodations that normal people like you and me
Why do they need those?
can give to them. Like
Yeah, but-
you don't have to actually walk a blind person to the door. You can just get the fuck out of their way. That's a lot of the times what they need.
No,
Because
this
they
isn't
have-
an argument
they
about what
usually
I have
have-
to do to accommodate them. It's about giving them the senses that they're missing.
Right.
It's
But
not. It's
here's
not
the-
about
here's
enriching
the
my
thing.
life. Their life is
At any-
better.
And this is something that I pointed out in the chat 3 times today. Stop screaming at me. 3 times today is at any time after birth, you can become disabled in any way. What are we going to do? Are we going to kill those people that become disabled? Because we aborted the people that were going to be born that way.
No, we
or prevented
we
it from happening.
aborted the reason why I gave the abortion if they didn't want to take the pill is because this person is choosing to abuse their child. If somebody is going to say, I'm going to let my child be blinded, like if somebody says, I'm going to blind your kid right now, unless you stop me, like, yeah, I'm
That
not going to
wasn't-
stop
that
you.
wasn't
They
the-
don't
the-
have
the-
a kid.
The thought exercise that we were having, that was the thought exercise that you guys were up here having is,
That's what I said.
should we be able to cure it? Should we be able to cure it?
Should we force
And
the
my argument was, at any time after birth, you can become disabled in a whole bunch of different ways.
yeah,
that
it's a tragedy. when it
Sometimes they're a lot
happens.
a lot worse than what you would have been born with.
Wait, so then what do we do with the people after? Okay, so we cured the blindness.
Exactly. So what do we do with the people
What do
after
we do with
birth?
people that are blind after?
We
Everything
have a
we
common.
can
If
to
we
help
can't
and
cure
fix
that, no,
it.
let me answer this. If we can't cure that, right, we still have those accommodations because they need them, right? We can't cure that.
So what
If we
people are
could,
curing it before
if we
birth?
could cure it, we should cure it. We're not talking
What's
about
the point of
killing
doing anything
anyone.
good if something
No
bad
one
can
is
happen?
dying, right? No one is going away.
What if the
What we're-
person who becomes disabled doesn't want the cure? Do we mandate the cure?
Yes,
because
we don't
then they'll
allow
be
people to be a drain on the system unnecessarily.
If somebody wants to end their life, we don't let them do it.
Actually, in Canada, we do.
Yeah.
All the time.
we explicitly do, and
People are ending their lives
I
all
argue
the time, whether it's
If
whether
we can
it's
not
stop
because
them
people are
and you
letting
don't,
them.
that's wrong.
We call this a tragedy for a reason.
Yes,
If
it
somebody
is.
is disabled after they're born, it's a tragedy. And if
No,
somebody
it's
could have
not.
stopped it and they
No,
didn't,
it's not. It's not always a tragedy. It is not
We
always
have
a
a-
tragedy.
we have an immense difference in values then. If my child becomes blind or deaf or in
You're
a
right.
wheelchair,
You
I
have
will love them and accept them, but it was a
Value.
tragic
I
thing that
have-
happened to my
I have
child.
3 children with disabilities. I have 1 with dwarfism and 2 with autism. I wouldn't have cured any of them because every single
course,
thing
you
that they've
know
gone
them
through
now.
in their every single thing that they've gone through because of what their disability is, it's not as bad. My disability was worse at birth. I was supposed to have died like 1,000 times before I turned 1. They kept telling me I was going to die. I finally I wasn't able to physically run until I was 4 because every time I would go faster than a basic walk, my heart would hurt. As a baby.
I'm not invalidating
None of my
any
kids
the
have
things
gone
that you're
through this.
saying.
None of my kids have gone through this. And
I don't
I'm
understand-
grateful for that.
I think
I don't
the
understand
point
They have their own
argument, though.
disabilities.
I think the
I would
argument is
never have
that
gotten rid of their disabilities. Never
Uh,
once.
Okay, I just
think
wanted to
the
make
argument
sure.
is
Hold on
that-
before you go,
Oh,
because
sorry.
I know people have to go. They have a hard out at
Yep.
8. It is 8, and I want to give them that hard out. If you have to go, I understand. We love you. Thank you for coming. Thank you for enjoying this conversation with us, but I understand. So I know that
Have an
Ali
extra
said he
5
had to
minutes.
go, and Corey had to go. So
I got the same 5 minutes.
oh, you guys got 5. Okay, well,
Yeah.
then carry on. I was just trying to be like
No, thank you. I
No, we
appreciate it.
appreciate
respectful of
Yeah.
your time, but
So,
go ahead.
Jenny, I have a quick hypothetical for you to show that, like, I think that you actually do agree with me. There is a switch that you have to push.
But then
you have to
I
turn
want
it left,
Arena
or
to
you
go
have to turn
because
it
Arena had
right.
something to say.
Yeah, this is like the last thing I have to say. I know I've talked a bunch because I've been losing my goddamn mind this whole time. If you turn the switch left, every single human being that's ever born from here on out will be blind and autistic. And if you turn it right, nobody that's born after you flip that switch will ever be born or autistic ever again. And if you don't flip it, the entire world dies, and so do all the animals, and the sun envelops us all. So you got to pick one or the other. Which one do you pick?
This is literally the dumbest Charlie exercise because it doesn't actually give you a real explanation of what you're doing. You're just doing an either
There's an
or.
explanation. Yes. I'm
There
trying
is no
to
good
see which one
answer.
you think is better. There is a good answer.
But
Not everybody
doing
being blind
nothing,
and autistic is better.
I think
I'm not saying I wouldn't prefer it if my oldest didn't have
Yeah, and that's what I'm saying. I'm not saying that they're
dwarfism or if my
bad.
other kids didn't have autism. I'm not saying I wouldn't prefer it, but they don't deserve to die because of it. And this entire last hour of you guys has been eugenics 101. And it's frustrating. And it's frustrating to see people that I view as friends up here talking about this shit. And it's frightening.
I think
I don't
the
want anybody
point
to
is that
die.
lives with disabilities are worth living, and those experiences are worth experiencing for people. And we have a variety of human experiences, and by eliminating that experience, you are homogenizing the human experience. And I think that many disability activists do talk about that, how they wouldn't
exactly
flip a switch to not be disabled anymore because they value that experience.
I don't think anybody here has talked about eugenics. I don't think anybody has really just said, they take
Before
a pill
you got on here,
and make the
Infallible.
person not exist. That's completely different.
Yeah, I'm curious who's advocated.
The problem
for
is that's what
killing.
it sounds like. That's what it ends up sounding. That's why me and Corey were like, well, I mean, it just sounds like you're just getting.
That's why I said we shouldn't use the word eugenics because it sounds like that.
Well, anytime you're saying
talking about aborting or taking a pill or putting something in the water to get rid of certain disabilities, that is eugenics, you guys.
But it doesn't get rid
yes,
of the
it is.
person.
In a good way.
It doesn't get rid of the person.
No,
it got rid of the disability. Vaccines are eugenics, right? Vaccines are a form of
That's the same.
eugenics.
Okay, that's the same as saying therapy can be sitting down on a couch and talking to somebody. It can also be electric shocks, or it could be lobotomy. That's all therapy. So since it's all the same thing, we can't have therapy.
What?
Yeah, the line of reasoning that you're going down, Jenny, says that I shouldn't take my ADHD meds. I shouldn't be able to get antidepressants.
I'm not saying that at all. You should use any and all accommodations afforded to you. What I'm saying you should use any and all accommodations afforded to you and available to you. What I'm saying is that your life as someone with ADHD is no less than somebody without ADHD.
Sure, and if my mom chose to if my mom could have prevented me from having it and she chose not to, fuck her, she abused me before I was even born.
How do you prevent someone from having it?
The hypothetical pill situation we were talking about. I would
the
hate
whole
my mother
question,
if she
I may
chose this for
clarify,
me.
there's a pill that you can take, and if you take it, your child, who is still in your womb, will not be born blind, deaf, with any problems at all, right? Deafness and blindness are what we settled on, right? Deafness and blindness, it would cure them of it. They'd still be born. They'd still be your kid. They just wouldn't have those two disabilities, deafness and blindness. Would you take the pill? And my argument is anyone who would not take the pill is immoral.
I would take the pill. I just wouldn't want it legally mandated. That's
I
the
think
question, right? Legally mandated.
Yeah, I think that it's.
I think we can socially shame people. We could use that. We could encourage people, but I think legally mandating medical treatment is wrong.
legally legally mandate that people can't purposely blind or deafen their kids.
Yeah.
Right. We do that. This is just a small step in the further in the direction. I don't think it's a slippery slope. I think it's just a small step to saying, hey, again, assuming no side effects in this hypothetical, assuming no cost, assuming there's literally no downside. All you have to do is take it. Okay. If you don't, I think there should be some legal penalties for that. Yeah.
When my kid was being born, my child wasn't getting enough oxygen, and my child's mother wouldn't keep the oxygen mask on her face because it was uncomfortable. She was ripping it off, and the doctor said, "Dad, you need to keep that mask on her face." And I put it up to her face. She'd get that fucking thing off me, and I said, "I can't." And I held it to her face to make sure that my child wasn't getting deprived of oxygen, because as a parent, I have a responsibility, and I don't care if the mother doesn't like it. My kid's coming first right now, and your feelings don't matter. Kid needs oxygen. If my kid's going to be born blind or deaf, Mom, you're taking the fucking pill. You don't get to make sure that you don't get to increase the odds of our kid being born deaf or blind. Or if we know it, you don't get to decide that they're going to be. Fuck that shit. I do the same thing as I do with the oxygen mask. Sorry, you're uncomfortable.
But that's when I asked,
Deal
what
with
do we
it.
do? What do we do in life when people after birth are deafened and blinded?
We treat them
Do we,
as
like,
human
tell them?
beings. We care about them, and we help them every bit of the way that we can. Of course. And if there's a cure, we give them the cure. This is
All right,
we
so
don't say
what do
kill
we
'em.
do with this? What do we do with this knowledge, knowing that absolutely no medication on the planet is 100% efficient in all humans? What do we do when it causes terrible side effects?
That's not part of the hypothetical.
If there was a
Well, then it's a dumb
hypothetical, it becomes a
hypothetical.
harder question. It becomes something we wouldn't mandate in that case, right? That if there's a possibility that, so an 80% chance that they will be cured entirely, but there's a 20% that something horrible will happen, no way we mandate that. None, right?
Mandating utopia is easy though. Like,
Yeah.
a mandated utopia is like that's an easy argument. Like, obviously,
People, well,
If I
you
could-
say
if I could
obviously,
actually
but we've been
live in a
arguing about
utopia,
this the
like,
whole
boom.
time, right? Like, people have been
Yeah.
arguing against my
Wait,
utopia, right?
Jenny, the hypothetical is designed
Well,
to see
because-
where people's values lay. It's a values test. Of course, it's super unrealistic that there's no side effects, but we're trying to see, do you take the obvious correct choice, or is there some weird shit you have going on in your head? You hold some
Well-
weird value that says objectively better, healthier, more vibrant children is bad if I have to do something I don't feel like doing.
Is that really
That's
testing
what
your
we're testing
values if
for.
if the
I
if
would
alternative
say
is
it differently.
utopia?
Like, my child deserves to be born as they are. The way I've always looked at it is my child deserves to be born as they are.
What if your child's gonna be born as a
if-
worm
Wait, I just,
and they go, you can just take this pill and they'll have all their limbs and it'll be super chill? You'd be like, no, I'm gonna take the worm, baby.
Yeah. I'm sorry, but like my child.
Okay,
My child
I'll
deserves
just,
to be born as they are,
At this
and
point-
unless it's a life-threatening,
This is a religious.
problem,
This is a
I would
religious
think
argument now.
nothing.
You are religious about this.
okay.
Kind of.
Thank
Yeah.
you, gang, for coming today. I really appreciate you
you.
all for being here. This has been a great show. If you've enjoyed this content, thank you for the $5, Artemis Fowl. To say, if we don't like people being a drain on the welfare system, boy, do I have some news for you. We'll just address that later. Tomorrow, 6 p.m. Eastern, I have a call-in show with community member Small Peanut has asked to be my guest, so why not? Well, I'll have her on, and we'll do a call-in. So call in tomorrow. Wednesday, we're going to be talking about canvassing. Thursday, we have some people on to debate on the Houthi strikes, the Houthi situation. And then Friday, gang, me and Destiny, the Omni-Liberal, will be teaming up, right, to combat Non-Smoker and 𝕬𝖓 the Great on the Houthi situation in general. It'll be a great debate. I'll be participating in the debate, not moderating, so that will be fun. So tune in,
What's
6
your
p.m.
position?
At 7
Who
p.m.
is
Eastern on
moderating?
Friday. And that will be fun. I don't know, but it'll be. I don't know who the moderator is, but it'll be Non-Smoker and 𝕬𝖓 versus me and Destiny. Tune
Where?
in
What channel?
7 p.m. Eastern. Huh?
On yours?
I'm
On
gonna
WhickTV?
stream it. Hell yeah!
On
Tune in to
hell
me.
yeah.
I don't care about these other people.
the-
But tune in to me.
that's
But
what we
anyway,
wanna hear.
I wanted to give Arena a chance to shout herself out, tell people where they can find her, because she didn't get a chance because she was off doing things. So I'm gonna give her that chance. Then we're gonna end this. Go ahead, Arena.
Thank you so much. Sorry I missed half the juicy panel. I was glad I was able to join for the last portion. You can find me on Arena Nana on YouTube and at monoshock.john on Instagram and TikTok. I make lifestyle, philosophy, and film analysis content. So a little bit of everything there for everybody.
What's your favorite movie, real quick?
Oh God, like of which genre? I have so many,
Okay.
but my favorite one I've seen recently is *Saltburn*. I
What's
did
your favorite
enjoy
movie you
that.
haven't
was
seen?
good.
Saltburn.
Saltburn was
Interesting. I'll let you guys go. We're rating out. We'll rate into Prime Kai. Make sure you let him know that this is a hate raid. But bye, everyone. Bye.
Always a pleasure.
See ya.
Great.